है बेटा, that is decreased urine output. Patient's lab workup is consistent with renal insufficiency. That is, the patient's kidney function is compromised, which is, and the patient is also suffering from anemia. ठीक है, तो elderly man having anemia along with renal insufficiency, X-ray of lumbosacral spine has been done, which shows multiple lytic lesions. Third important feature, okay, so multiple lytic lesions as shown in the X-ray below over here. ठीक है, apart from that, which among the following will be the findings in urine analysis? They are asking you, what is the provisional diagnosis of the patient? Very good. The provisional diagnosis of the patient over here in this case is a case of a multiple myeloma. We know that multiple myeloma is a plasma cell malignancy, beta, where there will be low backache due to the multiple lytic lesions, beta. Second, patient will have renal insufficiency or renal failure. Third, the patient will have anemia, beta. Okay? And fourth, the patient will have hypercalcemia. And due to that hypercalcemia, patient is having constipation and abdominal pain. Clear? So, चारों features दिए हुए हैं उन्होंने. Now, if they ask you definitely in patients of multiple myeloma, बच्चे, that which among the following will be the urine analysis का finding? बोलो. So we know that multiple myeloma में there is excess production of light chains of antibodies beta. And we know these light chains of antibodies or the kappa chains of antibodies are going to be excreted out in the urine of the patient. And these are nothing else but called as the Benz-Jones proteins beta. So answer has to be option D. Benz-Jones proteins will be found in patients of multiple myeloma. हमें पता है बेटा that TAM horsefall proteins which are there बच्चे, they are nothing else but they are going to form the hyaline cast. And we know that TAM horsefall proteins or the hyaline cast, it is a normal or abnormal finding. So we know both of this is a normal finding in the patient's urine. RBC cast is nothing else but suggestive of hematuria. So RBC cast is suggestive of hematuria, and we know it is usually seen in patients suffering from glomerulonephritis, especially nephritic or nephrotic syndrome. Mainly nephritic syndrome beta. That is important to be remembered. Apart from that, if they ask you, WBC cast will be a feature of. Very good. So WBC casts are usually seen in patients suffering from infection beta. That is nothing else but pyelonephritis. That is what is important to be remembered. So pyelonephritis के cases में WBC casts are seen. Next important is muddy granular cast will be a feature of. Muddy granular cast will be a feature of. Brown or muddy granular cast. Hmm? Answer will be a case of ATN. What is ATN? Acute tubular necrosis. So acute tubular necrosis में there will be muddy granular cast beta. Next important, if they ask you, sorry, about the broadcasts. Broadcasts are usually seen in patients suffering from CRF. What is CRF? Chronic renal failure. So in patients of CRF or chronic renal failure, you are able to see broad and maxi cast beta. That is important to be remembered. Hopefully done. So these are the expected urine analysis ka findings that you need to be aware of beta. Next is question number 52. 10-year-old child presented to you with lower abdominal pain along with purpuric rashes beta over the lower extremities along with hematuria in the patient. Workup reveals there is a normal platelet count. What will be the most probable diagnosis of this patient? So we know beta that these classical purpuric rashes on the lower limbs or even on the buttocks of the patient beta in a small child, and definitely the history that will be given beta along with this will be of abdominal pain and hematuria in the patient is a classical diagnosis of nothing else but option A, that is HSP or Henoch-Schonlein purpura. A very close differential for this condition can be acute ITP, acute immune thrombocytopenic purpura. How do you rule that out? Yes. So please remember in HSV patient, there will be a normal platelet count beta, but in patients of ITP or immune thrombocytopenic purpura, there will be thrombocytopenia or a decreased platelet count. That is how you differentiate a case beta. That has to be kept in mind. यहाँ पे हमेशा normal platelet count रहेगा. If they ask you what is going to be done for treatment, answer will be steroids beta. So please remember steroids are generally given in patients of in cases of HSP or Henoch-Schonlein purpura beta because this is an autoimmune condition basically. And which antibodies will be found? IgA beta. We know that the Henoch-Schonlein purpura is a IgA related small vessel vasculitis बच्चे. पोस्ट स्ट्रेप्टोकोकल ग्लोमेरुलोनेफ्राइटिस जो होता है बच्चे, तो यहाँ पे हेमाचूरिया जरूर देखेगा पेशेंट में, बट purpuric rashes will not be present. And important is where in cases of PSG and बच्चे, what will be the history that will be given to you? The patient will be having a history of sore throat or pharyngitis. due to an infection called as Streptococcus pyogenes beta. And after a Streptococcus pyogenes infection, patient is going to develop hematuria after 2 to 3 weeks or 2 to 3 days. So please remember, in cases of IgA nephropathy, the hematuria develops after 2 to 3 days. And in cases of PSGN, it develops after a span of 2 to 3 weeks beta. This is a classical diagnosis of PSGN or post-streptococcal glomerulonephritis. On histopathological examination, you are able to see a very classical picture. And that is nothing else but endocapillary proliferation. Histopath pe beta, definitely you are able to see endocapillary proliferation beta, but on the direct immunofluorescence, you are able to see the antibody deposits giving you a classical starry sky appearance. You will be able to see a starry sky appearance, also known as the lumpy, bumpy appearance beta. Hopefully clear. Treatment for PSGN is going to be nothing. It is a self-limiting condition, beta. No treatment is usually required in patients of PSGN or post-streptococcal glomerulonephritis. Kawasaki disease is basically a medium vessel vasculitis, beta. And here, the patient would have more than 5 days of fever, beta. And along with that, the patient should definitely have 4 out of the 5 cream features, bache. Now, when I talk about cream features, basically, C stands for conjunctivitis, beta. Next, R stands for rash. Okay, there will be erythematous maculopapular rash beta. E stands for edema and erythema beta. Edema is swelling, erythema is redness. So edema and erythema in the hands and feet beta. A stands for adenopathy. That is a unilateral cervical lymphadenopathy beta. And M stands for mucosal involvement. That is which tongue? Strawberry tongue. If I say strawberry tongue with bilateral cervical lymphadenopathy and sandpaper like rash, diagnosis is scarlet fever. Which organism? Streptococcus pyogenes beta. That is important to be remembered. Kawasaki disease mein beta, treatment is nothing else but, so here treatment has to be IVIG, that is intravenous immunoglobulins that we give along with aspirin beta. The only indication of aspirin in children is Kawasaki disease bache. ठीक है? Alport syndrome mein we have already discussed about the classical triad of can't see, can't pee and can't hear beta. ठीक है? तो यहाँ पे hematuria है, but बाकी features are not consistent with Alport syndrome. Question number 53, if I talk about, we have a known case of diabetic patient beta who came to the hospital with pigmentation of the skin as given below. Further investigations reveals there is a deranged liver function test and the biopsy is showing you micronodular cirrhosis beta with brown perinuclear deposits which will be seen within the hepatocytes or within the liver cells. What is the likely gene mutation associated with the given condition? Now, important is if I talk about this condition beta, here the patient is a known diabetic, and now the patient is having pigmentation of skin beta. What is this pigmentation of skin called as? Very good. This pigmentation of skin is known as bronze pigmentation of skin. I hope all of you are quite aware that whenever the patient is actually going to have bronze pigmentation of skin beta along with known case of diabetes mellitus, so it is basically a picture of bronze diabetes beta. And I hope all of you are quite aware that bronze diabetes develops when the patient is actually going to have deposition of iron beta. That is nothing else but hemosiderin pigment of iron definitely when it deposits. And that is known to cause definitely hepatitis and cirrhosis. And it is a brown perinuclear deposit which will be seen beta. So bronze diabetes is a feature of which condition? Hemochromatosis. Bronze diabetes is a feature in patients suffering from hemochromatosis. And we know that hemochromatosis occurs due to which gene mutation? Option C, that is a HFE gene mutation, is responsible for causing hemosiderosis or hemochromatosis. When I talk about hemochromatosis beta, here the brown perinuclear deposits, now they can be two things. Either it can be lipofuscin or it can be hemosiderin. To differentiate, which is the stain that we use? It is the Prussian blue. Yes, pulse is the reaction that we see definitely beta with the Prussian blue stain. That is, if that brown color deposit is of hemosiderin or iron beta, after applying Prussian blue stain, the deposits will turn blue in color. If it is lipofuscin, it will not turn blue in color. That is how you differentiate beta. That is important to be remembered. कोई दिक्कत नहीं. Treatment, if they ask you for hemochromatosis, definitely which we know that in this condition the treatment has to be a chelating agent for iron, and that chelating agent of iron is nothing else but deferoxamine beta. So deferoxamine is definitely the chelating agent of iron that we tend to use. We know that ATP7B gene mutation is known to cause Wilson's disease, and Wilson's disease mein there is copper deficiency or copper excess. So in patients of Wilson's disease, there is excess amount of copper which deposits and causes damage to various organs in the body. Patient will have classical jaundice-like features beta due to liver damage, and along with that, Parkinsonism-like features like tremor, rigidity, or bradykinesia. So yaad rakhna, any patient who comes to you with jaundice and Parkinsonism-like features together, that has to be a case of Wilson's disease beta. Investigation of choice over there also is a liver biopsy itself beta, which will be done. And what will be the drug of choice in patients of Wilson's disease? It is going to be triantine beta. Triantine is going to be the drug of choice, followed by zinc acetate beta. And the copper chelating agent used is known as D-penicillamine. The copper chelating agent is known as D-penicillin, which will be used. Important in patients of Wilson's disease beta, when the copper deposits inside the lens, the patient will develop. When the copper deposits in the lens, the patient develops a sunflower cataract. When the copper will deposit in the Descemet's membrane of cornea, then the patient develops a KF ring or a Kayser-Fleischer ring beta. Do remember that. ATP7A gene mutation is usually seen in patients suffering from Menkes disease, and Menkes disease is going to be copper deficiency beta. The copper deficiency is going to be Menkes disease that you have to remember, which that is important. Now, in Menkes disease, the patient will have hypotonia and hypotonia, mental retardation, and most important, kinky, brittle hair beta. That is a very classical feature of Menkes disease, which that is important to be remembered. Okay. APC gene mutation is associated with FAP syndrome, familial adenomatous polyposis beta. Clear? Chalo. Next important is question number 54, bache. Here we are having a question which says a patient underwent a surgery beta for a third molar extraction, which was causing pain and discomfort. Now, during this procedure, definitely a nerve has been injured or a nerve was injured beta. Which among the following will not be a feature of this nerve injury? Now, when you try to remove the third molar or the wisdom teeth beta, obviously in the floor of mouth, the nerve can get injured beta. And what is that nerve that is very closely related to it? It is mostly the lingual nerve beta. So the patient is going to have a risk of lingual nerve injury, which is a branch of mandibular nerve. Now, important is if the patient develops a lingual nerve injury, which among the following is not a feature that you have to pick up? Bolo. Option A says deviation of tongue to ipsilateral side. Will it happen? No, beta. Lingual nerve is not a motor nerve supplied to the tongue. Lingual nerve is only a sensory nerve supplied to the tongue. So if the lingual nerve is damaged, it will not cause any deviation of tongue. Deviation of tongue is usually seen if the patient is having a hypoglossal nerve palsy or a 12th cranial nerve palsy beta. Why? Because all the tongue muscles are usually supplied by the hypoglossal nerve or the 12th cranial nerve. So ipsilateral deviation of the tongue to the same side is seen in hypoglossal or the 12th cranial nerve palsy. Option B says decreased sensation in floor of mouth. Yes. Loss of general sensation is in the anterior two-third of tongue. Yes. Decreased salivation from submandibular or sublingual gland. Yes. But what is never seen is going to be option A, that is deviation of tongue to ipsilateral side is never seen due to a lingual nerve injury. That is what is important to be remembered. Important is if they ask you beta about the tongue innervation. I hope all of you are aware about the tongue innervation beta. ठीक है तो if I talk about the tongue innervation तो हमें पता है that anterior two third जो होता है basically from the anterior two third part of tongue beta the general sensations are going to be carried by which nerve? The lingual nerve, that is the branch of mandibular nerve, which is in turn a branch of the fifth cranial nerve, and taste sensations will be carried by chorda tympani nerve. Chorda tympani nerve is a branch of facial nerve, that is your seventh cranial nerve beta. That is important to be remembered. Now if I talk about beta from the posterior one third, so yaad rakhna from the posterior one third the general as well as taste sensation beta both of them are carried by which nerve? The ninth cranial nerve, that is nothing else but the glossopharyngeal nerve beta. And lastly, from the posterior most part of the tongue basically, or from the vallecula beta, from the posterior most part of the tongue or vallecula basically beta, we know that both the general and the taste sensations will be carried by the vagus nerve beta. It will be by the 10th cranial nerve, that is nothing else but your vagus nerve. Hopefully clear. So this is the sensory nerve supply of the tongue beta. That is what is important to be remembered. Clear? 5, 7, 9, and 10. Now, if I talk about next one beta, question number 55, which states a patient presented to the casualty or to the emergency beta with complaints of what? With complaints of severe diarrhea along with nausea and vomiting. He gives history of drinking water from a roadside hotel beta during his travel, and the BP of the patient is going to be okay 90 by 60 millimeters of mercury beta. He complains that he has a profuse rice water like stools beta. Okay, which of the following transport media can be used with for the causative agent of this condition? So I hope all of you are quite aware. He has drank water basically from a roadside hotel. That means it is having a fecal-oral route of transmission. Second, rice water like stools confirms your diagnosis of cholera. So the provisional diagnosis of this condition is nothing else but cholera. Okay. If I talk about cholera, we know it is caused by a bacteria known as Vibrio cholerae beta. Now, important is if I talk about what is going to be the transport medium used. So the best transport medium used for Vibrio cholerae is nothing else but Venkat Ramanan Ramakrishnan media beta, that is VR medium. Carry Blair medium can be used, but it is not the best transport medium. The best transport medium is VR followed by Carry Blair medium beta. That is what is important to be remembered. Clear about. Next important, McConkey agar is mainly used for which kind of organisms? Gram. Yes. So please remember, definitely, McConkey agar is mainly used for the gram-negative bacteria beta or the gram-negative organisms, usually like the Shigella, Salmonella, Staphylococcus. Okay, so sorry, Shigella, Salmonella, these kind of organisms which are there beta. For them, definitely we tend to use the McConkey agar. Next is going to be the buffered charcoal yeast extract beta. The buffer charcoal yeast extract medium, that is Bice medium, is generally used for what? It is mainly used for Legionella beta. The buffered charcoal yeast extract medium, which is there, it is mainly used for which bacterial growth? So it is mainly used for Legionella. What is this picture of? This is the buffered charcoal yeast extract medium, and this has been an image-based question over here. And on this buffered charcoal yeast extract medium, you are able to find, sorry, the whitish paste-like colonies. And these whitish paste-like colonies are nothing else but the Legionella bacteria itself, beta. These are nothing else but the Legionella bacteria. Clear? This is a classical picture of the McConkey's agar, beta. This is a classical picture of the McConkey's agar if I talk about. And if I talk about McConkey's agar, हमें पता है that the colonies which are going to be lactose fermenters beta, they will give you a pink color, and the colonies which are going to be non-lactose fermenters, they will give you a yellow color on the McConkey's agar. That is important to be remembered. Next, if I ask you bache, that what is going to be the best culture medium for Corynebacterium diphtheria? For diphtheria, the best culture medium is going to be the best culture media for diphtheria is going to be potassium tellurite agar beta. The potassium tellurite agar is going to be the best culture media for diphtheria, followed by the Loeffler serum slope beta. What is going to be the best culture media for Mycobacterium tuberculosis? Best culture media. Very good. The best culture media basically for Mycobacterium tuberculosis is the LJ media, that is the Lowinston Jensen media beta. It is the Lowinston Jensen media that you have to remember. What is the best culture media for Pseudomonas beta? So Pseudomonas के लिए the best culture media is going to be the cetrimide agar beta. The cetrimide agar is going to be considered as the best culture media for Pseudomonas. That is what is important to be remembered. Clear about? So do remember this. Now, if I come back to cholera beta, we know that cholera is going to cause rice watery diarrhea and it can lead to severe dehydration in the patient beta. Now, in case of cholera, we know that if they ask you what should be done for test, so we know there is a test called as the string test beta, which can be done on the stools of cholera, basically in the patient bache. Apart from that, if they ask you in patients of cholera that, sorry, what is going to be the what is going to be the treatment? So treatment ke liye beta, obviously we have to give ORS or we tend to give IV fluids. What is the IV fluid of choice in a patient of cholera beta? Very good. That IV fluid of choice in patient of cholera is always RL, that is Ringer's lactate beta. That has to be remembered. Apart from this, definitely, what is the drug of choice for cholera? Hmm? The drug of choice for cholera will be Anybody? Cyclins. So please remember the drug of choice for cholera will be drugs like doxycycline or tetracycline beta. So doxy or tetracycline like drugs are going to be the drug of choice for cholera patients. That is what is important to be remembered. Question number 56, if I talk about beta, a study was conducted on a large number of patients to compare a new drug basically with a placebo drug beta before launching the drug in the market. Which among the following, okay, before launching that drug in the market, which among the following study beta will be conducted here? Answer has to be option C, that is randomized control trial beta. First thing is the study is conducted on patients beta. That way itself will give you all the hint beta. We know that the study that is going to use patients as the unit of study will be RCT or randomized control trial. Second, हमें पता है that comparing a new drug with a placebo drug is usually done in which phase? It is usually done in phase 3 of the clinical trial beta. और मैंने पहले ही बोल दिया that in phase 3 of the clinical trial we have to go for randomized controlled trial beta, and that is the most important phase of clinical trial that you have to remember. Clear about? So that is important beta. Next important, if I, okay, so if I wanted to confirm definitely association between a particular risk factor and a disease, then I would go for the analytical studies like prospective cohort study or the case control study. यहाँ पे I don't want to definitely see the association between risk factor and the disease. Rather, I just want to see the comparison between a new drug and the placebo drug. That is important. Question number 57, if I talk about beta, here we are having a middle-aged female basically who is belonging from the rural areas. Beta has been brought with complaints of long history of diarrhea. Here also there can be a rice watery diarrhea which will be seen. Along with that, the patient will have fatigue and thickening of the palms and soles. Thickening of palms and soles is known as hyperkeratosis beta. Okay, the thickening of palms and soles will be called as hyperkeratosis with the below given finding. Below given finding देखोगे तो you are able to see beta there will be hyperpigmentation on the palms of the patient बच्चे, and this hyperpigmentation is classically known as which kind of pigmentation? It is classically known as the raindrop pigmentation beta which will be seen. ठीक है, it is the classical raindrop pigmentation which will be seen. So they are saying she also experiences tingling and numbness in the extremities beta, that is suggestive of peripheral neuropathy. What is the likely toxicity the patient is suffering from? Answer has to be very good. हमें पता है the rice watery diarrhea or cholera like diarrhea along with features of anemia, that is fatigue, thickening of palms and soles, that is hyperkeratosis, along with the raindrop pigmentation beta and neuropathy like features has to be nothing else but option D, that is arsenic poisoning beta. That is what is important to be remembered. हमें पता है that arsenic which is there definitely it is a homicidal poison or a suicidal poison. It is the most common homicidal poison beta. Why does the most common homicidal poison used? So it resembles a natural death beta. As like as arsenic toxicity causes a natural death, therefore it is used as the most common homicidal poison to kill someone beta. The best homicidal poison will be, or the ideal homicidal poison is always be thallium beta. So thallium is considered as the ideal homicidal poison, which is that is what is important to be remembered. ठीक है, so that is what is important to be remembered beta. Ideal suicidal poison is usually cyanide beta, that the take. ठीक है, तो याद रखना ये बात. Now important is definitely if I talk about arsenic में एक drawback है बेटा, and what is that drawback? Anybody? Drawback, yes. So please remember, it will be found in almost everything, beta. The hair, nail, bone, ash, soil surrounding the dead body, everything. You will be able to get arsenic in all of that, beta. That is a drawback of arsenic toxicity. Thallium poisoning agar hota, beta, so it will be very commonly resembling the arsenic poisoning, beta. Thallium poisoning mein, there are three features, beta. First, important, the patient will have alopecia. Second, the patient will have nail finding, and that nail finding is known as the iodric means lines beta, those transverse white lines. We know iodric means lines are also seen in cases of arsenic toxicity. They're also seen in patients of thallium toxicity beta. And apart from that, the third one, the patient is going to have diarrhea. So only if these three features were there beta, I would have said it is a case of thallium poisoning. But as definitely the other features are there beta, usually the patient is having features of anemia, hyperkeratosis, neuropathy, so it has to be a case of arsenic poisoning. Answer has to be option D. No issues with this. Mercury poisoning can happen basically either due to inhalation of the fumes beta, or due to eating the fish basically which has been grown in a water with excess amount of mercury inside it beta. That is important to be remembered. And mercury toxicity or poisoning mein the patient will have a slate gray stomach mucosa, that you have to remember. Phosphorus poisoning mein beta, phosphorus poisoning mein, if there is a acute phosphorus poisoning, the patient will have luminescent stools and luminescent vomitus. Chamak aayegi beta, stools and vomitus mein, that is important. And chronic phosphorus poisoning mein, the patient will have osteonecrosis of the mandible, and that osteonecrosis of the mandible beta is called as the Fossey jaw or the Lucifier's jaw beta. Okay? So that is what is important to be remembered. Question number 58, if I talk about beta, is a patient who had seafood bache immediately develops respiratory distress. Along with that, the patient also develops wheezing and hypotension beta. He was given an injection of adrenaline to counteract the effects of histamine release. ठीक है, हमें पता है if the patient has eaten seafood बेटा, उसके बाद immediately if he starts developing respiratory distress, wheezing and hypotension, मतलब the patient has developed what? Anaphylaxis beta or anaphylactic shock. Okay, we know that definitely the patient might be allergic to the seafood, and due to that, the patient might have developed anaphylaxis or an allergic reaction. And in allergic reaction, I hope all of you are quite aware that the chemical mediator responsible is known as histamine beta. And for treatment, we have given the drug of choice for anaphylaxis, that is injection of adrenaline, IV or IM. IM beta 1:1000 dilution. So यहाँ पे adrenaline and histamine, adrenaline is given beta to reverse the effects of histamine. This is basically based on which among the following types of antagonism between adrenaline and histamine beta. Answer. तो we know beta that अगर मैं histamine की बात करता हूँ, basically we know that histamine is actually going to act on the histamine receptors beta, the H1 and the H2 receptors definitely, and due to that the patient is going to have vasodilatation. But on the other hand, but on the contrary, basically adrenaline is going to act beta, and adrenaline mainly acts on which receptors? Alpha 1 receptors, as it is a sympathetic neurotransmitter, and it is known to cause vasoconstriction. So they are causing same effect or opposite effects? Opposite effect. One is causing dilatation, second is causing constriction, so they are both antagonists of each other beta. Okay, and definitely beta, this is a classical example of option C, that is physiological antagonism beta. That is a classical example of physiological antagonism. Pharmacological जो antagonism होता है बच्चे, so please remember that pharmacological antagonism मतलब, for example, if I say adrenaline is actually going to bind beta, let's say with the beta 1 receptors, and due to that it is going to increase the heart rate of the patient. Okay, whereas if I give a beta blocker something like metoprolol beta, okay, I have given a beta blocker like metoprolol, now it will again bind with the beta 1 receptor itself beta, it will again definitely bind with the beta 1 receptor, same receptor ko bind karke block kar dega, and due to that the patient will not have any increase in the heart rate, rather the patient's heart rate is going to decrease. So same action or opposite action? Opposite action beta. And as it is known to cause opposite action basically, therefore it is going to be an antagonist beta. And this is going to be a pharmacological antagonism where one is a natural neurotransmitter in your body, another is basically a drug that is blocking the receptor. Clear about this? Is pharmacological antagonism. No issues with this? Chalo. So there will be physical and chemical antagonism also. Physical antagonism जो होता है basically beta, it is due to the charcoal. So I hope all of you are quite aware beta. In cases of poisoning, we can give we can use activated charcoal beta, and that charcoal is responsible for causing adsorption. Adsorption का मतलब होता है definitely all the poison will attach to the surface of charcoal and then it will be taken out from the patient's body. That is an example of physical antagonism. Activated charcoal will be an example of physical antagonism. Clear? Question number 59, if I talk about beta. Chemical antagonism भी last याद रखना. For example, अगर मैं बात करता हूँ like let's say beta, if I talk about a condition definitely where the patient has taken heparin. ठीक है? So we have given heparin to a patient beta, and now the patient developed a heparin toxicity. Now to counteract the heparin toxicity बच्चे, we have to give a drug which is an antidote, and that is nothing else but protamine sulfate beta. This will be an example of chemical antagonism. Hopefully clear to all of you. Chalo. Question number 59, if I talk about beta, is a child has been brought to you beta in the pediatrics OPD with complaints of fatigue and distended abdomen bache. Lab workup was done, which reveals the child is having a severe fasting hypoglycemia along with ketosis and lactic acidosis beta. And the child is also having features of hepatomegaly and palpation. What is the likely enzyme deficiency to be observed in this patient? Bolo. What is the classical diagnosis? So we know it is a classical case of glycogen storage diseases. And as it is a case of glycogen storage diseases, we know the enzymes responsible for glycogen metabolism will be absent in the patient's body. Jiski वजह से beta, as the glycogen is not broken down, the patient will have a severe fasting hypoglycemia. And due to severe hypoglycemia, the body will start producing ketone bodies that is called as ketosis, and lactic acidosis will also happen. And they have very specifically mentioned that the patient is having hepatomegaly. Matlab this problem is only and only related to the liver beta. We know there are two types of glycogen storage diseases which are related to liver bache. One is going to be type 1, that is von Gerke's disease, which is due to deficiency of an enzyme called as glucose 6 phosphatase. Okay, glucose 6 phosphatase beta. Whereas another is type 6 glycogen storage disease known as HERS disease, which is due to deficiency of an enzyme called as hepatic glycogen phosphorylase beta. In both the condition, liver is the only affected organ beta. How do you make a diagnosis whether it is von Gerke's or HERS? बोला हुआ है मैंने. तो we know beta याद रखना von Gerke's disease में the enzyme used is glucose 6 phosphatase, which is required for two process beta. First glycogenolysis and second gluconeogenesis. So von Gerke's में when this glucose 6 phosphatase enzyme is deficient, no process will occur in the fasting or starvation state, and therefore the patient will develop a severe fasting hypoglycemia that can cause ketosis and lactic acidosis. But in a case of HERS disease beta, the enzyme deficient is hepatic glycogen phosphorylase, which is only and only required for the process of glycogenolysis. So even if glycogenolysis will not occur during the fasting state, gluconeogenesis can still happen beta, and therefore in HERS disease, the patient will have only a mild hypoglycemia and therefore no ketosis and no lactic acidosis. So अगर severe fasting hypoglycemia along with ketosis and lactic acidosis बोला हो, so diagnosis is always von Gerke's disease beta. And जब diagnosis has to be von Gerke's disease beta, we know the patient is having deficiency of option D, that is glucose 6 phosphatase enzyme bache. That is what is important. Von Gerke's, I hope all of you are quite aware, is the most common type of glycogen storage disease beta. That is important. Now, if I talk about type 2 glycogen storage disease is known as Pompey's disease, and it is due to an enzyme called as lysosomal 1 alpha, sorry, lysosomal alpha 1 to 4 glycosidase deficiency beta, also called as acid maltase beta. So this 1 to 4 glycosidase deficiency which is there beta, it is nothing else but acid maltase deficiency beta. Type 3 basically, and type 4 if I talk about. Type 3 is known as Cory's disease due to the debranching enzyme deficiency, and type 4 is going to be Anderson's disease due to the branching enzyme deficiency beta, CDAB. And last important is type 5, that is McArdle's disease. Type 5 of McArdle's disease is due to deficiency of muscle glycogen phosphorylase, and here the only organ affected is going to be the muscles beta. Patient will have exercise intolerance. Important, अगर मैं ये पूछता हूँ बेटा that which is the most common type of glycogen storage disease in children, answer will be von Gerke's disease. Most common type of glycogen storage disease in adolescents or adults, answer will be McArdle's disease. That is important to be remembered. Next important, floppy BB will be seen in severe hypotonia, or floppy BB is a feature of, very good, floppy BB, cardiomegaly. These are features of Pompey's disease beta. That is what is very, very important to be remembered. And hepatomegaly will be mainly a feature of type 1, that is von Gerke's disease, or type 6, that is HERS disease beta. Okay. चलो हमें पता है that hepatic glycogen phosphorylase is absent in patients of HERS disease, where there will be only a mild hypoglycemia, not a severe one. Beta glucocerebrosidase deficiency or beta glucosyl ceramidase deficiency is seen in a lipid storage disorder which is called as Gaucher's disease beta. Okay. Whereas if I talk about The galactose 1 phosphate uridyl transferase deficiency is seen in patients of galactosemia beta. It is the most common enzyme deficiency in classical galactosemia beta. That is what is important to be remembered. Hopefully cleared all of you now. Chalo. Question number 60, if I talk about beta, the unidirectional movement of neutrophils basically beta from the blood vessel towards the inflammatory site will be carried out by which among the following chemical mediators? What is this process called as? ये पहले बताओ. Unidirectional movements of neutrophils from the blood vessels till the site of inflammation. Hmm? This procedure is known as chemotaxis beta. And I hope all of you are quite aware that chemotaxis is carried out by chemoattractants which is going to be the most potent chemoattractant. कौन सबसे ज़्यादा attract करेगा? Bacteria himself na. Bacterial endotoxins are going to be the most potent chemoattractants beta. Agar wo endogenous पूछते हैं, that is from your own body, then obviously it is going to be beta C5a. The most potent chemoattractant is always C5a beta, followed by the other chemoattractants will be leukotriene, B4, and it can be interleukin 8. So that is what is important to be remembered. These are going to be the chemoattractants beta or the chemotactic stimuli. Now next important is once the neutrophils goes at that site beta, then the bacteria is going to be coated and then it will be made tasty beta for phagocytosis. That process is known as opsonization. If I talk about the process of opsonization, if they ask you that which is the most potent opsonizer, तो if they ask you beta most potent opsonizer की अगर मैं बात करूं तो it is basically the FC fragment of IgG beta. The FC fragment of IgG basically is going to be the most potent opsonizer, whereas the most potent complement opsonizer is going to be C3b. Most potent complement opsonizer is C3b, and another opsonizer is also going to be fibrinogen. Fibrinogen is also an opsonizer that you have to remember. Hopefully clear to all of you now. तो दोनों में गड़बड़ा मत जाना. Chemotaxis is different and opsonization is different completely. Clear? So that is important. तो यहाँ पे उन्होंने बोला है about chemotaxis, and as they have asked you about chemotaxis beta, either you will find definitely bacterial endotoxins or C5a, but both of them are not there. Next is leukotriene B4 or interleukin 8. What is given? Option A, that is interleukin 8. Okay, we know it is responsible for the activation of neutrophils beta. That is important. C3b is an opsonizer, not a chemotactic stimuli. FC fragment of IgG is again an opsonizer, not a chemotactic stimuli. TNF alpha is responsible for fever in the patient beta. Clear? So that is what is important to be remembered. अगर वो बोलते हैं first process we know is margination, second process is rolling. Which molecules are responsible for rolling? Very good. So selectants are responsible for rolling beta. They are CD62 molecule bache. Next, now there will be firm attachment and that is called as adhesions. Which molecules are responsible for adhesion beta? हमें पता है that integrins are responsible for adhesions beta. And integrins are nothing else but ICAM1 or VCAM1 बच्चे. That is what is going to be integrins. Next is the process when the neutrophils come outside the cell beta, known as transmigration, also known as diapedesis. And who is responsible for diapedesis is PECAM1, that is platelet endothelial cell adhesion molecule 1, that is CD31 beta. That is what is important to know. Then there is process of chemotoxis, then there is process of opsonization, then there is process of phagocytosis, then there is phagolysosomal fusion, and then the bacterial killing will happen beta. This is the process of inflammation. Hopefully that's clear. What is the hallmark of acute inflammation? It is increased vascular permeability beta. That is blood vessels become leaky. That is important to be remembered. Question 61. In a patient who was suspected beta to be a case of lactose intolerance, the following test was performed and it came out to be positive HA. What is the test basically? What is the test being performed here in this patient? We know this is a classical picture of option D, that is a Benedict's test beta. This is a classical picture of Benedict's test. जहाँ पे you will take the urine sample of the patient and you will add definitely beta a Benedict's reagent to it. Once you add a Benedict's reagent beta, if the sample does not change the color, matlab the sample does not contain any amount of reducing sugar. But if the sample starts changing the color beta from green to yellow, yellow to orange, orange to red, that means the sample contains large amounts of reducing sugars beta. As the patient is having lactose intolerance, the lactose will not be digested and all that lactose will get excreted out in urine beta. And we know that lactose is a reducing sugar bache. Therefore, the Benedict's test will come out to be positive. This has been an image-based question of your examination. So, yaad rakhna. In patients of lactose intolerance, the Benedict's test will be positive beta. That has to be kept in mind. Which are the two non-reducing sugars? Only two non-reducing sugars. बाकी usually all of them are reducing in nature बेटा. Non-reducing sugars का अगर वो बोले तो answer has to be, it is trehalose and sucrose beta. So trehalose and sucrose are the two sugars definitely which are going to be non-reducing in nature. These are disaccharides. Hopefully clear to all of you now. Chalo. So that is important. Biuret test is done for proteins. Rothera's test is done for ketone bodies, and Selivanov test is done for amino acids again. Clear about that is what is important to be remembered. Okay. Next important, if I talk about question number 62. Here we have an elderly female patient beta who develops skin rashes along with swelling of eyes and along with the swelling of tongue and lips as well, leading to her breathing difficulty as well beta. She might have developed edema inside the larynx also. On history taking, she was taking medications which for hypertension and congestive cardiac failure beta. Which among the following medications beta can be the reason for her condition? So we know beta, this is classically what? Swelling of eyes, swelling of tongue and swelling of lips. This is nothing else but called as angioedema. And we know that angioedema is an adverse effect or a side effect beta that is usually happening due to increased amount of bradykinin beta. So when there is increased amount of bradykinin beta, the patient will have angioedema. And second important problem will be dry cough beta. Right? These are the two problems which will be associated. Here you are able to see definitely that angioedema. So this is a classical problem or a side effect associated with which drugs? Option D, that is captopril. The pril group of drugs are going to be ACE inhibitors beta. ACE is nothing else but angiotensin converting enzyme inhibitors. We know that this ACE inhibitors or these captopril, lisinopril like drugs beta, they will stop the RAAS mechanism and therefore help in decreasing the blood pressure of the patient beta. Okay, propanolol is a beta blocker. It does not cause any edema. Telmisartan is a ARB or angiotensin receptor blocker. They have similar action to that of ACE inhibitors, but they do not cause these side effects like angioedema or dry cough beta because they do not increase the bradykinin levels. Previous year exam में ये तक पूछा था कि कौन सा chemical molecule responsible है. Answer is bradykinin. Please remember that. ठीक है. Hydrochlorothiazide beta, thiazides are known to cause hypocalcemia, hyponatremia, hypomagnesemia, except hypomagnesemia, hypophosphatemia, hyponatremia, hypokalemia, except hyperkalemia. Hypercalcemia. Calcium levels are going to increase basically beta. Now यहाँ पे अगर देखोगे तो this is the RAS system beta. That is what understand. जब भी patient का BP ज्यादा होगा कम होगा कब activate होगा system? Whenever the patient's BP is going to decrease beta, immediately the renin, angiotensin, aldosterone system is activated. In which what will happen? The JG cells which are there beta, these JG cells or the juxtaglomerular cells, they are going to release renin. Why? Because the beta 1 receptors in the JG cells will get activated beta. And once renin is released, it will convert angiotensinogen into angiotensin 1. Then angiotensin 1 is converted into angiotensin 2 by another enzyme called as angiotensin converting enzyme or ACE released by lungs. That was a PYQ again in your exam. ACE is released by. And next, angiotensin 2, it will directly cause some action. And secondly, it will also increase the release of aldosterone beta. And we know हमें पता है that whenever aldosterone will come into action, then there will be increased sodium and water reabsorption beta. There will be increased sodium and water reabsorption and decrease and excretion of potassium and H plus ions beta. Now यहाँ पे याद रखना, if they ask you, ये picture देखे वो कहीं भी mark करके drug पूछते हैं. First of all, please tell me beta, which drugs will be called as renin release inhibitors? बोलो. Renin release inhibitors. That was a PYQ once. Beta blockers are known to cause the renin release inhibitors because renin release occurs due to the beta 1 receptor. So the beta 1 blockers or beta blockers will be the renin release inhibitors, beta. That is important. Next, which are the direct renin inhibitors? The direct renin inhibitors are usually drugs like ariskiren, remikiren. All the kiren group of drugs basically will be the direct renin inhibitors, beta. Next, which are the ACE inhibitors, beta? So all your pril group of drugs, beta, that is captopril, lisinopril, all these prils basically will be the ACE inhibitors, beta. Which drugs will act at this site? The ARBs, beta, that is angiotensin receptor blockers, basically the drugs known as sartans, beta. So those drugs known as valsartan, losartan, they are going to block the angiotensin receptors. Which drug will act at this site, beta? Aldosterone antagonist, and aldosterone antagonist drugs like spironolactone basically or eplerenone, they are going to block the aldosterone action. Hopefully clear to all of you now. So याद रखना ये बात, वो ये मार्क करके एग्जाम में पूछ चुके हैं पहले, ठीक है? चलो. So now if I talk about definitely the next one, that is question number 63, beta. After first meiotic division, beta, the primary oocyte usually remains arrested in which phase? तो याद रखना बेटा, see here, normally what we know that the spermatogonium which is there, beta, it undergoes growth or maturation and then forms the primary spermatocyte. After that it undergoes a meiosis 1 and that leads to formation of two secondary spermatocytes, beta. After that the secondary spermatocytes will undergo meiosis 2 and it will lead to formation of four spermatids. These four spermatids will undergo differentiation and maturation, bache, and that will lead to formation of a mature spermatozoa. Next important, if I talk about oogonium, beta. This oogonium again undergoes a growth and maturation and it leads to formation of primary oocyte. This primary oocyte undergoes meiosis 1, beta, and then it leads to formation of a secondary oocyte basically and the first polar body. Now when a secondary oocyte is formed, please remember the meiosis 1 is not completed. The meiosis 1 is arrested in which phase? It is arrested in prophase, beta. It is arrested in prophase. And which stage of prophase? The diplotin stage of prophase, beta, it gets arrested in. Next, the secondary oocyte, beta, undergoes meiosis 2, leading to formation of a ootid now along with a second polar body. Again, the meiosis 2 is not completed, beta. Meiosis 2 again gets arrested in which phase? Metaphase 2. Okay? The meiosis 2 gets arrested in metaphase 2, beta. That is what is important. And then ultimately, the meiosis 2 is completed at the time of fertilization, beta. Okay? So that is what is important to be remembered. Hopefully clear. So yaad rakhna, after the first meiotic division, beta, the primary oocyte remains arrested in option C, that is diplotin stage of prophase 1 or 2? 1. Diplotin stage of prophase 1, beta. Metaphase mein the secondary oocyte gets arrested basically, beta, not the primary oocyte. That is what is important to be remembered. Okay? So answer has to be option C for this question. Hopefully clear. Spermatogenesis ke liye how much time is required? So please remember, beta, 74 days are basically required usually for the process of spermatogenesis. And then additional 12 days are required for which process? The additional 12 days are basically required for the process of spermiogenesis, beta, where it stays inside the epididymis, bache, and it will attain the motility and maturation, beta. That is the process of spermiogenesis that is going to take place. Hopefully that's clear. How much is the lifespan of sperm? Yes, the lifespan of sperm is going to be 3 days, beta. That is nothing else but 72 hours. And what is the lifespan of an ovum? So ovum ka lifespan is obviously going to be 24 hours, beta. That is what is important to be remembered. No issues with this, anybody? Now, if they ask you about question number 64, here we are having a 55-year-old man, beta, who has presented to us with symptoms of fatigue, and he has also swelling in the feet and he is also swelling in the feet, beta, along with loss of sensations basically in the legs. The patient is also suffering from anemia, beta. Okay. He also has dilatation of the ventricles and a high output cardiac failure is noted on echocardiography. Which enzyme activity, beta, can help in diagnosing the suspected vitamin deficiency? Please tell me, first of all, what is the suspected vitamin deficiency in this patient? Patient is having definitely features like high output cardiac failure, along with swelling of feet and loss of sensation, that is peripheral neuropathy. Neuropathy along with heart failure. हमें पता है that whenever a patient has CVS, that is cardiovascular features, that is heart failure, along with neuropathy, it has to be a case of wet beriberi. Only neurological features will be dry beriberi. Clear है बात? So wet beriberi is the diagnosis, and wet beriberi happens due to deficiency of which vitamin? It happens due to deficiency of vitamin B1 beta, and we know that vitamin B1 deficiency is also known as thiamine deficiency beta. यहाँ पे if you want to check the levels of vitamin B1 in the patient's body, you should check for which enzyme activity. Answer has to be option C, that is trans ketolase activity beta. Glutathione reductase activity, you will check if you are suspecting a case of vitamin B2 deficiency beta. So glutathione reductase activity we will check definitely in patients of vitamin B2 deficiency. Transaminase activity we will check for vitamin B6 deficiency. Transaminase activity we check for vitamin B6, that is pyridoxine deficiency beta. ठीक है. Dihydrofolate reductase activity we check for, in case if you want to, you can check it for B12 deficiency. Reason, B12 is basically responsible for activation of folic acid, and that's the reason definitely it will be like it will be like, and this dihydrofolate reductase enzyme is dependent on vitamin B12 beta for its action. Hopefully clear to all of you. हमें पता है that whenever a normal patient or a polished rice eater will have a vitamin B1 or thiamine deficiency, he will develop beriberi beta. Only neurological features, dry beriberi, neurological features along with heart failure, wet beriberi beta. Important, if a chronic alcoholic develops vitamin B1 deficiency beta or thiamine deficiency, that is classically known as, we know, Wernicke's Korsakoff syndrome beta. Acute deficiency is known to cause Wernicke's encephalopathy, and chronic deficiency is known to cause Korsakoff psychosis. हमें पता है that Wernicke's encephalopathy में the patient will have a classical triad known as GOA, global confusion, ophthalmoplegia and ataxia. Korsakoff psychosis mein patient will definitely have psychotic features like delusion and hallucinations, along with uh, making false stories to fill up the memory gaps, called as confabulations beta. That is what is important. If the patient is brought to you in the emergency with Wernicke's encephalopathy, what should be given first, thiamine or dextrose? Always give IV thiamine followed by IV dextrose. Again, a PYQ in your examination. Do remember that. Hopefully, that's clear to all of you now. Next, if I talk about question number 65 beta. So here they have said a patient was suffering from palpitations along with dizziness and recurrent syncopal attacks. These are the symptoms of, bolo, palpitations, dizziness, and recurrent syncopal attacks. These are the usual features of arrhythmias beta. Because in arrhythmias, the body or the organs will not receive enough blood supply. That's the reason these problems will happen. Clear? He was diagnosed definitely with WPW syndrome beta. We know WPW syndrome is arrhythmia itself. It is a pre-excitation syndrome known as Wolff-Parkinson-White syndrome. Here, which aberrant bundle is present? WPW syndrome may definitely, here there is the aberrant bundle known as bundle of Kent beta. Why are these? The impulses are going to reach before time to the ventricles beta, and that will cause pre-excitation of the ventricles. Which wave on ECG will be found? Very good. In patients of WPW syndrome beta, you are able to see the classical delta wave. That is what is important to be remembered. Now, in patients of WPW syndrome, we have to start antiarrhythmic drugs, and therefore the patient was started on oral lecanide therapy beta. Now, important is, if they ask you that what is going to be the treatment of choice in this patient, तो आंसर क्या होगा? सी, आईवी अगर कोई ड्रग देना है तो आईवी ड्रग हैज टू बी आईवी प्रोकेनामाइड. ओरल अगर मेंटेनेंस के लिए देना है तो फ्लेकेनाइड देते हो. ठीक है, तो मेंटेनेंस के लिए वी गिव ओरल फ्लेकेनाइड, इमरजेंसी में वी गिव आईवी प्रोकेनामाइड. बट ट्रीटमेंट ऑफ चॉइस इफ दे आस्क यू बेटा, इट इज आरएफए. व्हाट इज आरएफए? रेडियो फ्रीक्वेंसी अब्लेशन, तो जो abnormal bundle है बेटा, you have to definitely ablate that bundle with the help of radio frequency ablation. That is what is important to be remembered. Now here they are asking you that flecainide is given to the patient. This drug mainly inhibits which phase of the action potential from the image given below? Now let's see one by one beta. If I talk about phase 0 beta, so we know that this C, phase 4 is nothing else but RMP or the resting membrane potential beta. And for heart muscles, we know it is going to be minus 90 millivolt. Clear? So for heart is minus 90 millivolt beta. That is important to be remembered. Now, first phase is definitely as soon as the impulse comes, okay, then definitely what is going to happen? The sodium channels will open and there will be a sodium influx or efflux. There will be a sodium influx. So phase 0 is sodium influx beta. Next, once the threshold limit is reached beta. Next, in phase 1 now, what is going to happen? Now definitely the sodium channels are going to close. And which channels will open? Potassium. And as the potassium channels will open, there will be a potassium efflux. So phase 1 is potassium efflux beta. Potassium will go out of the cell. So the so the membrane potential starts decreasing over here. Now comes the phase 2 beta. Phase 2 may definitely, the potassium channels are already opened. Now the calcium channels will also open up beta. So there will be a potassium efflux and at the same time the patient will have a calcium influx. So there will be a balance and therefore there will be a plateau which will be there in phase 2 beta. Phase 3 may calcium channels will close and only which channels will stay open? Only the potassium channels will remain open, causing a potassium efflux. So again, phase 3 is only and only the potassium efflux beta. And stage 4 is the process of hyperpolarization and then back to normal. अब मुझे बताओ definitely, there are how many groups of antiarrhythmic drugs that we have? There are total 4 groups of antiarrhythmic drugs beta. Class 1 antiarrhythmics, if I talk about, तो क्लास वन एंटीअरिथमिक्स आर गोइंग टू बी सोडियम चैनल ब्लॉकर्स बेटा. तो याद रखना, तो क्लास वन एंटीअरिथमिक्स आर डेफिनेटली गोइंग टू बी द सोडियम चैनल ब्लॉकर्स बेसिकली बच्चे. नेक्स्ट क्लास टू एंटीअरिथमिक्स विल बी बीटा ब्लॉकर्स बेटा. क्लास थ्री एंटीअरिथमिक्स विल बी potassium channel blockers बच्चे. And class 4 antiarrhythmics will be CCBs, that is calcium channel blockers beta. Now important is one by one अभी मुझे बताओ definitely that sodium channel blockers will act on which phase? हमें पता है sodium channel blockers will act on phase 0 of action potential. Then the potassium channel blockers act on which phase? Mainly the phase 3 beta. Potassium channel blockers will mainly act on the phase 3 basically over here. Okay? So they will have action on 1 and 2 also, but mainly on the phase 3 basically. That is important to be remembered beta. Okay? So these are the point. And calcium channel blockers will act on which phase beta? The calcium channel blockers are going to act on which phase bache? The calcium channel blockers will act on the phase 2 of the action potential. That is important to be remembered. अब यहाँ पे फ्लेकेनाइड कौन से ग्रुप को बिलोंग करता है? दिक्कत तो यही है. तो प्लीज रिमेंबर बेटा, फ्लेकेनाइड लाइक ड्रग्स बेसिकली बिलोंग टू सोडियम चैनल ब्लॉकर्स. ठीक है, तो फ्लेकेनाइड बिलोंग्स टू सोडियम चैनल ब्लॉकर्स. इंपॉर्टेंट ड्रग्स याद रखने हैं इस ग्रुप के. वन इज डेफिनेटली लिग्नोकेन, second is going to be procainamide or quinidine, and third important is going to be flecainide. These are the important drugs of sodium channel blockers that you need to remember beta. ठीक है, याद रखना. Next, beta blockers तो सबको पता है, all the drugs that end with lol. There is only one beta blocker beta which is included in the potassium channel blocking category, and that is sotalol. Sotalol is the only exception, which is a potassium channel blocker mainly. And next is the longest antiarrhythmic drug known as amiodarone, is a potassium channel blocker. Calcium channel blockers, all of you are quite aware beta. One is, there will be diltiazem beta. ठीक है, diltiazem. Next is verapamil. And third is going to be definitely beta the dihydropyridines. That is all the drugs definitely which have dipin in their name. Nimodipin, nifedipin, nicardipin, amlodipin, all of them. ठीक है, चलो. So अभी मुझे बताओ, flecainide is a sodium channel blocker, we know. So it will act on which phase? Phase 0 of action potential. Answer has to be option A. Clear है बात? Question number 66, if I talk about, here we are having a 26-year-old male beta who has been brought to you with long-standing history of fatigue beta along with pallor. with recurrent infections basically and bruising also. He gives history of parvovirus infection in the childhood beta. Bone marrow biopsy has been done and it has been given below. What is the most probable diagnosis? तो यहाँ पे अगर मैं बात करूं बेटा तो उन्होंने दिया है हिस्ट्री पार्वोवायरस इन्फेक्शन का. वी नो दैट पार्वोवायरस इन्फेक्शन इज नोन टू कॉज एरिथेमा infectiosum, which is a fifth disease leading to a flapped cheeked appearance, but it can lead to complications like it can cause aplastic anemia or a pure red cell aplasia both. यहाँ पे देखते हैं सिम्टम्स क्या है. सिम्टम्स अगर देखोगे तो पेशेंट इज हैविंग लॉन्ग स्टैंडिंग हिस्ट्री ऑफ फटीग एंड pallor. That is classically suggestive of anemia. But the patient is also having recurrent infections. That is suggestive of leukopenia. And the patient is also having bruising or bleeding. That is suggestive of thrombocytopenia. Matlab all the three are going to be deficient beta, and that is a case of pancytopenia. And if you see the bone marrow biopsy beta, तो बोन मैरो एस्पिरेशन विल बी हैविंग अ ड्राई टैप बेटा, कुछ नहीं दिखेगा बोन मैरो एस्पिरेशन करोगे तो. एंड बोन मैरो बायोप्सी करोगे तो दिस इज द क्लासिकल फीचर व्हिच इज सीन. व्हाट आर दीस? These are nothing else but fat globules beta. So inside the bone marrow you are able to see lesser number of cells but more amount of fat. तो अगर बोन मैरो बायोप्सी पे ज्यादा फैट दिखता है बेटा, more than definitely the blood cells, that means it is a diagnosis of classically option D, that is nothing else but aplastic anemia. Aplastic मतलब nothing is formed beta, therefore the patient will have pancytopenia. अगर option C होता pure red cell aplasia, patient will only have deficiency of RBCs and only fatigue and pallor. Okay, leukopenia या thrombocytopenia, that is recurrent infection and bruising, should not have been there. Clear? And even in the bone marrow, you should have been able to see definitely with the blood cells. But aplastic anemia में almost the whole blood bone marrow is replaced by fat cells or fat globules. Clear है बात? Myelofibrosis, maybe there is pancytopenia, but one thing, it is not associated with parvovirus infection. Second important thing, myelofibrosis में fat globules are not seen in the bone marrow biopsy beta. In cases of myelofibrosis, this is the classical feature beta. This is the classical feature beta. क्या दिख रहा है? Fibrous tissue. So all the fibrous tissue is going to be present beta in the bone marrow in a patient suffering from myelofibrosis. Myelodysplastic syndrome is not seen over here. Myelodysplastic syndrome may definitely beta. The patient has mainly problem with the cells originating basically from the myeloid lineage. That's it. Next important, if I talk about beta, question number 67. A statistical test has been performed bache, to compare the fraction of individuals who lost weight beta with green tea intake. Okay. In diabetic and non-diabetic individuals bache. Which test you would have used beta? So now if I talk about statistical test ke bare mein beta, there are two types of statistical test. One is parametric and second is non-parametric test beta. Parametric test mein what are we going to compare? Parametric test mein we compare a quantitative data, that is nothing else but either a mean or any kind of value beta. Okay? Whereas if I talk about non-parametric test beta, it is a qualitative test. Here we compare a qualitative data beta, and qualitative data ka matlab we are either going to compare any kind of percentage bache or we are going to compare the fraction basically. Hopefully clear to all of you now. So do remember this. So if I say parametric test where we compare mean or value beta in one group, then it will be a case of अरे क्या होगा? Paired student t-test beta. When I compare the mean value or the average value in two groups, then it is a case of unpaired student t-test beta. And definitely when I compare the value in more than equal to three groups beta, then it is a case of ANOVA test bache. That is what is important to be remembered. Next important if I talk about is about the नॉन पैरामेट्रिक टेस्ट बेटा. अब नॉन पैरामेट्रिक टेस्ट में अगर मैं बात करता हूं तो प्लीज रिमेंबर इफ आई कंपेयर बेसिकली दिस नॉन पैरामेट्रिक टेस्ट बेटा in one group, then it is a case of when I compare fraction or percentage in one group, it is a sign test. When I compare the fraction or percentage in more than equal to two groups, it is going to be a chi-square test beta. Now coming back to this question, it says basically beta, we are comparing what? We have to compare the fractions definitely beta. So comparison of fraction, matlab non-parametric test. Okay. Now, in how many groups we have to do it? Two groups. One group is diabetic individuals. Second group is non-diabetic individuals beta. So two groups में जब भी तुम fraction compare करते हो, it is a case of option C, that is chi-square test beta. If they remove fraction and if they ask you about the value, then definitely the answer will be an unpaired student t-test. Clear? Chalo. Next important, if I talk about question number 68, easy. A child has been brought to you beta with complaints of progressive jaw swelling and history of anorexia along with weight loss and low grade fever beta. Biopsy taken from the swelling has been given below. What is the chromosomal translocation likely to be seen in the patient? What is the likely diagnosis? The provisional diagnosis of the patient is a case of Burkitt's lymphoma beta. And if I talk about Burkitt's lymphoma, it is a type of non-Hodgkin's lymphoma, bache, that you have to remember. We know it is usually seen in African children beta, usually in the cervical lymph nodes. And when you do the histopathological examination after lymph node biopsy, you are able to see this classical starry sky appearance beta. The malignant cells are seen as sky and the macrophages in between are seen as twinkling stars beta. So this is the classical starry sky appearance which will be found. Important is in cases of Burkitt's lymphoma beta, what is going to be the gene mutation? Eh? Okay. The gene mutation in patients is going to be C MYC beta. So please remember definitely the C MYC gene mutation which is there, definitely it is going to be seen in patients who are suffering from Burkitt's lymphoma. Next important, if I talk about beta, is going to be translocation. क्या होगा? Answer has to be option C, that is translocation 2 8. हमें पता है even number with 8, 8 looks like B, ऐसे याद रख लो. Translocation 2 8, translocation 8 14 and translocation 8 22. These are the common translocation associated with Burkitt's lymphoma beta. Translocation 11 14 is associated with multiple myeloma beta. 1114 can be associated with multiple myeloma. Next, translocation 922. हमें पता है translocation 922 is Philadelphia chromosome, that is BCR-ABL1 gene translocation that is associated with CML, that is chronic myeloid leukemia, and translocation 1517, that is PML RARA gene translocation. So translocation 1517 is associated with the M3 variety of acute myeloid leukemia or M3 AML, that is acute promyelocytic leukemia beta. Hopefully that's clear to all of you now. So do remember these are the important translocations that you need to remember for the examination. If they ask you in patients of Burkitt's lymphoma, we know investigation of choice is a lymph node biopsy, but treatment will be given by which regime beta? A chemotherapy given by the R-CHOP regime beta. So R-CHOP regime ka chemotherapy will be given to the patient. Chalo. Done with this. Next important, if I talk about question number 69, here we are having an obese patient beta presented to you with the below given finding, and a history of stroke was there beta in this female few years ago. Lipid profile reveals that the total cholesterol of this female is around 234 milligrams per deciliter beta, and the LDL, that is low density lipoprotein, is 127 milligrams per deciliter. HDL value is 38 milligrams per deciliter and triglyceride is 120 milligrams per deciliter. What is the likely defect in this patient? बोलो बोलो क्या high है इस patient का? We know the total cholesterol level should be less than 200 milligrams per deciliter. Here it is high. Second, the total LDL value should be less than 100 milligrams per deciliter. Here it is again high. So which type of cholesterol is high? Mainly LDL cholesterol is high beta. That is your bad cholesterol is going to be high. Okay? So please remember in this patient basically beta the LDL cholesterol is going to be high. And whenever the patient's cholesterol is going to be high, we call that condition as a familial hypercholesterolemia. We call that condition as familial hypercholesterolemia. And in these patients beta, you are able to see the cholesterol deposit below the skin. And when there will be deposition of cholesterol below the skin beta, these yellow color deposits are found known as xanthal asthma. These yellow color deposits are formed known as xanthelasma. अब अगर मैं बात करता हूँ बेटा अबाउट द टाइप्स ऑफ हाइपरलिपिडीमिया और हाइपरलाइपोप्रोटीनीमिया इन शॉर्ट, तो प्लीज रिमेंबर, याद रखना, द टाइप 1 is known as familial chylomicronemia beta, and in this patient obviously the lipoproteins which will be more are going to be chylomicrons. We know chylomicrons are known to transport what, cholesterol or triglyceride? It is known to transport triglyceride. So this is a case of hypertriglyceridemia beta. That is important. यहाँ पे the defect is either in an enzyme called as lipoprotein lipase or in the activator known as ApoC2 beta. The patient will have high risk of acute pancreatitis and eruptive xanthomas, not xanthelasma, xanthomas. ठीक है, ट्यूमर लाइक दिखता है वो. नेक्स्ट, familial hypercholesterolemia, that is a type 2A hyperlipoproteinemia beta. Here the defect is usually seen with LDL receptor beta or ApoB100. Here the lipoprotein which will be elevated beta will be LDL, and LDL is known to carry cholesterol. Therefore, it is known to cause familial hypercholesterolemia beta. Here the patient will develop a premature atherosclerosis beta along with xanthal asthmas. Next important is type 3b beta. Type 3 beta. Type 3 जो होता है definitely it is known as familial dis beta lipoproteinemia, that I've also told you. It is also called as broad beta disease beta. So familial dis beta lipoproteinemia or broad beta disease. Here there is a defect in ApoE. ApoE is the remnant for ApoE is basically the Langer used for remnants. तो यहाँ पे किसकी level बढ़ेगी? Remnants की. तो chylomicron and VRDL remnants का value is going to increase. We know remnants are mainly known to carry triglyceride and slight like minimal amounts में कोलेस्ट्रॉल बेटा. तो यहाँ पे दोनों बढ़ जाएगा बट मेनली ट्राइग्लिसराइड्स बढ़ देंगे बेटा. दैट इज इंपॉर्टेंट. हियर आल्सो पेशेंट विल हैव प्रीमेच्योर अथेरोस्क्लेरोसिस अलोंग विद xanthomas. ठीक है, एटलीस्ट रिमेंबर दीज थ्री, दे आर वेरी वेरी इंपॉर्टेंट. अब यहाँ पे इट इज अ केस ऑफ familial hypercholesterolemia बेटा, एंड हमें पता है familial hypercholesterolemia और type 2A hyperlipoproteinemia में there is high level of LDL and due to that there is high level of cholesterol. Here there is a defect in LDL receptor. Answer has to be option B. It is a case of LDL receptor defect beta. Lipoprotein lipase deficiency is known to cause type 1 hyperlipoproteinemia जहां triglyceride levels ज्यादा होती है बेटा. Clear? यहाँ triglyceride level is normal. Normally triglyceride should be less than 150 milligrams per deciliter. Dysfunctional ApoE में बेटा triglyceride as well as cholesterol levels both should be high बेटा. ठीक है, LCAT deficiency में cholesterol ester की level ज्यादा होती है बच्चे. That is important. Question number 70 now. While taking the blood sample of a patient beta, a nurse has spilled few drops of blood बच्चे on the floor. Which among the following disinfecting agent will you use बच्चे to clean it? सरकारी question बोलो. We know definitely if there are blood spills on the floor beta, the best disinfecting agent will be 1% sodium hypochlorite to be used beta. That is what is important to be remembered. Now important is, we know that hydrogen peroxide or povidone iodine, both of them are used for cleaning or disinfecting the wounds basically beta, not for the floor. That is important. Isopropyl alcohol is used for disinfection of, it is instruments, mainly the instruments which come in contact with skin beta. The instruments like thermometers or stethoscope beta. So thermometers or stethoscope ke liye. It is also used as a preservative for which suture? Catgut suture, na? That is important. What is definitely used beta for the disinfection of all those scopes? Endoscope, bronchoscope, proctoscope. So for disinfection of all those scopes, definitely the disinfection used is Sidex beta. And Sidex is nothing else but 2% glutaraldehyde beta. It is going to be 2% glutaraldehyde. Hopefully clear. Which gas is generally used for beta? The fumigation of OT. OT fumigation is done by which gas? So OT fumigation is basically done by the formaldehyde gas beta. So formaldehyde gas which is there definitely beta. It is generally used for OT fumigation. Bache. No issues with this anybody? So that is what is important to be remembered. At least remember these important ones beta. Clear? किसके लिए बोल रहे हो? ओटी फ्यूमिगेशन के लिए, ओटी फ्यूमिगेशन के लिए आज तक भी कोई कोई ओटी है बेटा, यूजुअली गवर्नमेंट की, जहां पे फॉर्मल्डिहाइड गैस यूज होता है, ठीक है। एंड दैट इज डेफिनेटली वंस इन अ वाइल, ऐसा नहीं कि रेगुलर यूज होता है। जो वंस इन अ वाइल होता है बेसिकली 24 घंटे तक ओटी, 24 से 48 घंटे तक बंद रखते हैं फिर, ठीक है। नेक्स्ट इंपॉर्टेंट, इफ आई टॉक अबाउट क्वेश्चन नंबर 71 बेटा, इट इज अ पेशेंट हु वाज अ नोन केस ऑफ गैस्ट्रिक कैंसर बेटा, हैज अंडरगॉन विद सर्जरी, हैज अंडरगॉन अ Bilrod surgery बच्चे, and chemotherapy was given with which drug? Cisplatin beta. She has now come for a follow-up with complaints of persistent vomiting. हमें पता है that cisplatin is the most emetogenic anti-cancer drug beta. Which is the drug basically to be given in the patient for treatment? So I hope all of you are quite aware beta, if there is a cisplatin-induced vomiting. So this is a classical, okay, so we know cisplatin is known to cause early vomiting or delayed vomiting. So we know cisplatin causes a delayed vomiting usually after 24 hours. So there is a cisplatin induced delayed vomiting. And cisplatin induced delayed vomiting mein, what is the drug of choice beta? Is it cetrons or pitans? Very good. So cisplatin induced delayed vomiting beta, it is basically the neurokinin antagonist beta, also called as neurokinin antagonist beta, also known as substance P antagonist basically. ठीक है, तो ड्रग ऑफ चॉइस विल बी न्यूरोकाइनिन और सब्सटेंस पी एंटागोनिस्ट, एंड ऑल दी सब्सटेंस पी एंटागोनिस्ट बेटा वी नो डेफिनेटली दे आर गोइंग टू एंड विद द suffix pitants, new pitant, aprepitant. तो आंसर has to be option D beta. Now apart from cisplatin beta, any other anti-cancer drug if it is given and that causes vomiting, that is known to cause an early vomiting beta. तो बाकी कोई भी अगर कीमो, रेडियो, ओके, कोई कीमोथेरेपी या रेडियोथेरेपी इंड्यूस्ड वॉमिटिंग का केस है, या कोई भी पोस्ट ऑप वॉमिटिंग का केस है बेटा, देन इन दोज कंडीशंस डेफिनेटली बच्चे व्हाट इज द ड्रग ऑफ चॉइस? यस, तो कीमोथेरेपी इंड्यूस्ड, रेडियोथेरेपी इंड्यूस्ड और एनी पोस्ट ऑपरेटिव वॉमिटिंग में, देन अदरवाइज द ड्रग ऑफ चॉइस इज ऑब्वियसली बेटा द 5-HT3 agonist or antagonist? Antagonist. The 5-HT3 antagonist or blockers beta all the cetron group of drugs, that is ondansetron, granisetron, palinosetron. That is what is important to be remembered beta. Hopefully clear to all of you now. Chalo. So that is important. Palinosetron is the most potent cetron that you have to remember. Next important, if I talk about beta, domperidone and metoclopramide, both of them are also antiemetic drugs itself beta. But please remember that domperidone is generally used for the which vomiting? There is a levodopa induced vomiting beta, uske liye the drug of choice is domperidone basically. Why? Because we know definitely metoclopramide is actually known to cross the blood brain barrier and can lead to central side effects. That's the reason definitely domperidone will be given beta, which will not cross the blood brain barrier and will not cause any kind of central side effects beta. So levodopa induced vomiting में domperidone is given. तीन चीजें related to vomiting, वही सरकारी questions तुम्हारे. First, what is the drug of choice for morning sickness? Recent question. We know morning sickness usually happens in first trimester of pregnancy beta, and the drug of choice is going to be doxylamine beta. That is important to be remembered. Next, what is the drug of choice for motion sickness? तो हमें पता है drug of choice for motion sickness is going to be scopolamine, which is nothing else but hyoscine beta. And sarkari, what is the drug of choice for mountain sickness? So drug of choice for mountain sickness, which is there beta, it is nothing else but acetazolamide, which is a carbonic anhydrase inhibitor. Hopefully clear to all of you now. Chalo. So that is important to be remembered. If they ask you about question number 72, what will be the relation beta between, they are asking you what will be the relation between the measures of central tendency. Which three are the measures of central tendency? Mean, median and mode beta in the below given data distribution. अगर इस डेटा डिस्ट्रीब्यूशन को देखा जाए बेटा, more number of values will be over which side? It is basically towards the left side beta. The pointing graph will be towards the left side. And if it is a left sided graph definitely beta, or a left skewed graph definitely, तो क्या होगा? If it is a left skewed or a left pointed graph, it is positive or negative? negatively skewed graph. And negatively skewed graph में the mean is going to be the least, followed by median, followed by mode. Answer has to be option C. तो यहाँ पे देख सकते हो बेटा, this is a normal graph बेटा, and normal standard distribution is also known as Gaussian distribution beta. Normal standard distribution is known as Gaussian distribution. इसमें equal number of values are on both the sides of the mean beta. यहाँ पे mean, median and mode, all of them are going to be equal beta. Next important, here it is a negatively skewed graph basically. Why? Because the longer tail of the graph is going towards the negative side or the left side beta. And negatively skewed graph में हमें पता है that mean is going to be less than, median is going to be less than mode beta. Whereas if I talk about the positively skewed graph beta, that is when the longer tail of the graph is towards the positive side or the right side beta. Here definitely the mean is going to be more than, median is going to be more than mode beta. Hopefully that's clear. Now, how many percent values? If they ask you definitely beta that how many percent of values are going to lie between plus to minus 1 standard deviation. प्लस माइनस 1 स्टैंडर्ड डिविएशन में कितनी परसेंट वैल्यूज होती है? 68% data lies between plus minus 1 standard deviation. How many percent values lie between plus minus 2 standard deviation? So 95% values lie between plus minus 2 standard deviation. How many percent values lie between plus minus 3 standard deviation? 99.7% of values lie between plus minus 3 standard deviation beta. That is what is important to be remembered. Hopefully clear to all of you now. Chalo. Next question number 73. A consanguineous couple beta has visited to the clinic with a genetic disorder bache in the family history. The pedigree analysis was done beta and it has been given below. What is the pattern of inheritance which has been followed by this disorder beta? So here हमें पता है definitely जब भी Mendelian pattern of inheritance पता लगाना हो, I've told you two things basically that you have to check for. First, whether there are any kind of carriers or not, okay, और secondly बेटा whether there is any crisscross inheritance or not. ठीक है? तो अगर in case if the carriers are present बेटा, that is which type carriers अगर है तो it is recessive or dominant. We know that if carriers are going to be present beta, that means it is a recessive trait that you have to remember beta. One thing. Second way, जब recessive sorry जब carriers ना दिए हो, another way is basically beta to see skipping of generation. Again, if skipping of generation is present, again it is a case of a recessive trait beta. तो skipping of generation अगर दिखती है तो again it is a trait of again it is a recessive trait itself. Okay, and if the disease is present in all the generations, it has to be a dominant trait then. Next important beta, if I talk about that is crisscross inheritance. Crisscross inheritance का मतलब mainly बोलो. Crisscross inheritance का मतलब a deceased father who is there beta. Okay, a deceased father is going to transmit the disease only to all the daughters beta. ठीक है, तो please remember, if a deceased father can only transmit the disease to all the daughters, not to the sons, this is called as crisscross inheritance beta. If crisscross inheritance is present, then it is X-linked or autosomal. If crisscross inheritance is present, then it is X-linked beta. Hopefully that's clear to all of you now. ये तीन चीजें जब देखनी आ जाए तो मैं पेडिग्री एनालिसिस समझ में आ जाएगा. तो यहाँ पे are carriers present? I hope all of you are quite aware. These are considered normal. These are known as carriers and these are deceased. तो carriers तो है, तो carriers है तो मतलब it has to be recessive beta. Another condition, is there a skipping of generation? Yes, there is skipping of generation. तुम बोलोगे कैसे? बेटा carriers means carriers does not mean disease. उसको कोई साइन सिम्टम नहीं होंगे, मतलब कोई डिसीज नहीं है जनरेशन में. So definitely this is skipping of generation which is present over here. Clear? Again here also there is skipping like यहाँ पे इन कुछ कुछ लोगों में डिसीज नहीं है. Next important if I talk about बेटा is रेसेसिव है, ये तो कंफर्म हो गया बेटा. अब रेसेसिव के बाद ये पता लगाना है कि वेदर इट इज एक्स-लिंक्ड और इट इज ऑटोसोमल. क्या देखना होगा? क्रिस क्रॉस इनहेरिटेंस. सी द फादर. Here you can see the father is transmitting the disease to daughter, not to son. Here also if you see, okay, जहां जहां father affected होगा बेटा वहां पर disease only will go to the daughter beta, not to the son basically. So here, as crisscross inheritance is followed, it has to be which pattern of inheritance? Option A, that is X-linked recessive pattern of inheritance beta. That is what is important to be remembered. ठीक है? अगर कैरियर्स नहीं होते और हर जनरेशन में डिसीज प्रेजेंट होता बेटा, then I would have called it as X-linked dominant बच्चे. Okay. Next, what does this picture suggest you of? First of all, are you able to see carriers? No. So it is recessive or dominant? Dominant. Second important, is there any skipping of generation? No. Again, that means it is dominant for sure. तो अब dominant तो है, but अब ये कौन सा dominant है ये पता लगाओ. क्रिस क्रॉस इनहेरिटेंस दिख रहा है क्या? नहीं, क्योंकि फादर को देखो, इज ट्रांसमिटिंग द डिसीज टू बोथ डॉटर एज वेल एज सन बेटा. सो नो क्रिस क्रॉस इनहेरिटेंस, मतलब इट इज autosomal in nature. So this is going to be an autosomal dominant trait beta. Hopefully clear to all of you now. This is how you identify the pedigree analysis. Question number 74. फालतू का बड़ा क्वेश्चन है बेटा. A 55-year-old male is admitted in the hospital with complaints of severe pain in the lateral aspect of his left calf and small amount of pus discharge beta from the ingrown hair basically. So it is a case of folliculitis beta, which is actually causing that pus discharge. On physical examination, local area is found to be red, warm and tender. That is signs of inflammation are present. Pus is aspirated bache and subjected to the gram stain. Okay, and that is showing you gram positive cocci beta, which are present in clusters. This definitely makes it very clear beta, gram positive cocci in clusters. Culture on blood agar was done beta, it shows golden yellow pigmented beta hemolytic colonies. Matlab beta hemolysis can be shown by this organism beta. What is the causative agent responsible for this? We know that here definitely it is an infection of nothing else but the ingrown hair beta. That is a folliculitis of furuncle. हमें पता है most common cause of folliculitis of furuncle is going to be Staph aureus. Second reason, gram positive cocci in clusters will be Staph beta itself. ठीक है, and beta hemolysis is usually shown by Staph aureus beta, Staphylococcus aureus. Okay, understood. We know Staphylococcus epidermidis is not a known cause or a common cause basically for folliculitis or boils beta. Okay, next important, Streptococcus जो होता है, it is not found in clusters, it is found in chains beta. There will be chains of Streptococcus. ठीक है, Enterococcus is not known to cause these infections. तो यहाँ पे you are able to see these are gram-positive cocci which are present in grape-like clusters beta. Clear है बात? चलो. Next important, if I talk about question number 75. Urea, creatinine and nitric oxide are derived from which among the following amino acid? I've told you this. हमें पता है that arginine is responsible for the production of urea, creatinine and nitric oxide beta. That has to be kept in mind. ठीक है? Methionine is responsible for production of two things. One is SAM, that is S-adenosyl methionine. What is function of SAM? SAM or S-adenosyl methionine beta, it is a universal किसका? Methyl group का. So universal methyl donor beta. Universal methyl donor is going to be S-adenosyl methionine. Second, methionine is also responsible for production of a toxic amino acid known as homocysteine. And third, another amino acid known as cysteine beta. These amino acids are formed with the help of methionine itself. Glycine and histidine I have already told you. Clear है बात? Question number 76. Here we are having a pregnant female beta who is a known case of sickle cell anemia. She comes for a routine antenatal checkup and has history of neural tube defects beta in the previous child. What shall be the recommended dose of folic acid supplementation to be given in this child? She is having history of neural tube defect in the previous child. So can I say she is a high risk female? Yes. Now, normally, अगर मैं पूछूं that, please tell me beta, that WHO recommended dose of folic acid is? WHO recommended dose in normal pregnant females is going to be 400 micrograms per day. Next, Indian folic acid tablets contain how much? So we know that India may definitely beta, the folic acid tablets that we have, they contain 500 micrograms per day. If they ask you beta high risk females, the dose is going to be 4000 micrograms per day. High risk matlab the females who are currently taking anti-epileptic drug or there is a previous history of, and if the female is a known case of sickle cell anemia, then the dose has to be 5000 microgram per day. मैंने बोल चुका हूं कि ये प्रीवियस ईयर क्वेश्चन है तुम्हारे एग्जाम का. Answer has to be option D, that is 5000 micrograms per day or 5 milligrams per day, because she is a known case of sickle cell anemia. इसीलिए हाई रिस्क डाला जाता है, just to confuse you. क्लियर है बात? Basically, if they are asking you about the folic acid supplementation that you usually give, then you can mark it as 500. But if they ask you about the folic acid recommended dietary allowance, then you have to mark 400. RDA जो होता है, that is 400. ठीक है? If they ask you definitely beta about, sorry, sorry. If they ask you definitely beta that folic acid supplementation कब start करना होता है? On the folic acid supplementation usually is started on first antenatal visit beta. Okay, but if it is a high risk pregnancy, then we have to start 3 months prior to the conception. 3 महीने पहले से start करना होता है अगर high risk है तो. Hopefully clear. 180 days in pregnancy and 180 days in lactation, basically beta, that has to be given. No issues with this anybody? So do remember this अच्छे से. ठीक है? If they ask you neural tube defects के लिए बेटा, please tell me neural tube defect में what is going to be the most common marker that we tend to use? Most common marker for neural tube defect. Most common. Maternal serum alpha fetoprotein beta. Most common is maternal serum ka alpha fetoprotein. Which is the best or the most specific marker? So best or the most specific marker is going to be serum acetylcholine esterase beta. The best marker is going to be serum acetylcholine esterase. Hopefully that's cleared all of you now. Chalo. Question number 77. An obese patient who is a known case of type 2 diabetes mellitus beta has been prescribed a drug, but few weeks later beta, the patient presents to your OPD with features of gastroparesis. That is, the food is not able to go from stomach into the duodenum because the motility of the stomach is affected. What is the likely drug responsible for this problem? क्या हुआ? 180 days in pregnancy, 180 days in lactation, you have to give the folic acid supplementation beta. ठीक है? अब बताओ क्या है? Which drug is responsible for this gastroparesis? So it is the GLP analogs beta, and those GLP-1 analogs is nothing else but option B, that is semaglutide. So drugs like semaglutide, liraglutide, these are definitely the GLP-1 analogs basically beta, and they are definitely known to cause a side effect, that is gastroparesis. Second important, they are also known to cause another side effect, and that is a dangerous side effect known as acute pancreatitis beta. They are known to cause acute pancreatitis. And secondly, if I talk about beta, the semaglutide or liraglutide like drugs, they have also been approved for the treatment of, yes, so weight loss or obesity treatment के लिए beta, you can definitely give semaglutide or liraglutide like drugs. That is what is important to be remembered. ठीक है? Next is pioglitazone. Pioglitazone is basically a thioazolinated ions beta. That is important. Canagliflozin is going to be a SGLT2 inhibitor, and linagliptin is a DPP4 inhibitor. Now, if I talk about beta, that is linagliptin safe to be given in renal failure? So we know that the DPP4 inhibitors are usually not safe in renal failure. The only DPP4 inhibitor or gliptin which is safe in renal failure, answer will be linagliptin. Lina hi lena. That is what is important. Next important, if I talk about beta, it is going to be about that which is the antibiotic beta known to increase the risk of UTI. Sorry, which is the anti-diabetic drug known to increase the risk of UTIs? It is SGLT2 inhibitors because they are known to cause glucose urea, all your gliflozin group of drugs beta. Next, please tell me beta that which is the condition, which is the anti-diabetic drug beta, which is contraindicated in patients suffering from inflammatory bowel disease because it can increase the inflammation. The anti-diabetic drugs contraindicated in patients of inflammatory bowel disease because that drug may cause definitely gas production. Alpha glucosidase inhibitors, drugs like acarbose, voglibose, miglitol. These acarbose like drugs are usually contraindicated in patients of IBD beta. That is what is important to be remembered. Okay? If they ask you that where, what is the drug that is known to cause megaloblastic anemia? Yes, megaloblastic anemia and lactic acidosis definitely are the side effects that are that are associated with the drug of choice for type 2 diabetes mellitus, nothing else but your metformin beta. The metformin is known to cause megaloblastic anemia and lactic acidosis. That is what is important to be remembered. No issues with this, anybody? So do remember this. Okay, all the insulins are given via the subcutaneous route, except which insulin can be given via the IV route. So we know beta the only insulin which can be given via the IV route answer is regular insulin. Therefore, it is the drug of choice in cases of diabetic emergencies like diabetic ketoacidosis or non-ketotic hyperosmolar coma. So in conditions में regular insulin is going to be the drug of choice. Hopefully clear to all of you now. So do remember that. These are the important points that you need to remember. Question number 78, beta. A child was brought to you with features of headache, vomiting, and fever, beta, along with a purpuric rash, basically, which is present on the trunk and extremities of the child. CSF analysis has been done, which reveals there is low glucose levels along with elevated proteins, and neutrophils are present, beta, with the below given gram stain. Which statement is false? Which statement is false among the following? So as they have mentioned, neutrophils are present along with low glucose. Has to be a diagnosis of acute bacterial meningitis beta. Now, which bacterial meningitis it is? Anybody? Very good. तो याद रखना बेटा, it is a case of acute bacterial meningitis. ये तो ठीक है. But the bacteria that is responsible beta, you can identify that with the help of this purpuric rash beta. We know meningitis with a purpuric rash along with these gram नेगेटिव कोकाई डिप्लोकोकाई बेटा. तो ये जो ग्राम नेगेटिव डिप्लोकोकाई दिख रहे हैं, these confirm your diagnosis of nothing else but meningococcus. So please remember, definitely the cause responsible is meningococcus, also known as Neisseria meningitidis. So it is a case of meningococcal meningitis beta, which is the most common strain or subtype of meningococcus leading to meningitis. कौन सा strain है that will cause meningitis more commonly? The most common strain of meningococcus causing meningitis will be strain A beta. Which strain is absent in meningococcal conjugate vaccine? Strain B beta. The strain B is absent basically in the meningococcal conjugate vaccine or the MCV batch. That is what is important to be remembered. Hopefully that's clear to all of you now. Chalo. तो यहाँ पे देख सकते हो. If they ask you definitely what is the wrong statement, option A says it is caused by a gram-negative diplococci. Is it true? Yes, it is a gram-negative diplococci beta. Option B says Addisonian crisis may occur as a complication. Yes, हमें पता है बेटा. There can be adrenal hemorrhagic necrosis due to meningococcal infection, and that can cause a Addisonian crisis known as Waterhouse-Friderichsen syndrome beta. That can be a complication. Thayer-Martin culture media can be used for culture. Yes, Thayer-Martin is one of the best culture medias for meningococcus. What is wrong? Option D is wrong. Azithromycin is not the drug of choice, beta. We know penicillins are the drug of choice, especially penicillin G. So please remember, beta, penicillins are the drug of choice. Penicillin G is the drug of choice, beta. That has to be remembered for the treatment of meningococcal meningitis. If they ask you about chemoprophylaxis, beta, तो अगर chemoprophylaxis की बात करूं मैं, so please remember बच्चे, chemoprophylaxis में if they ask you definitely that what is going to be the drug of choice, definitely beta, for chemoprophylaxis of meningococcal meningitis. Drug of choice in chemoprophylaxis of meningococcal meningitis will be, बोलो, ciprofloxacin. We know the drug of choice has to be ciprofloxacin, but we know ciprofloxacin cannot be given in pregnancy and children. So pregnancy and children में अगर उन्होंने पूछ लिया कि what is going to be the chemoprophylactic agent of choice, answer will be ceftriaxone beta. The safer agent is going to be ceftriaxone. Hopefully that's clear to all of you now. Chalo. Question number 79. If they ask you over here that we are having a 26-year-old female beta currently using COCPs, that is current combined oral contraceptive pills as contraceptive method beta, and she was diagnosed with pulmonary tuberculosis. So she was started on treatment. Clinician has advised her beta to add a barrier method as an additional precautionary measure for contraception. What is the reason behind this? Very good. तो हमें पता है basically बेटा that there are certain enzyme inducers बच्चे. तो हमें पता है that enzyme inducers if they are given with some other drug beta which is metabolized by the microsomal enzymes, तो क्या हो जाएगा? These enzyme inducers will stimulate the enzyme. The enzyme will get overactivated and it will metabolize that other drug very, very fast. So that will cause failure or toxicity. That will cause failure of the other drug beta. That is important. The mnemonic to remember enzyme inducers is GPR is cell phone, G for griseofulvin, which is an antifungal drug, P for phenytoin, R for rifampicin, S for smoking, C for carbamazepine, and P for phenobarbital. We know majority anti-epileptic drugs are going to be enzyme inducers itself, beta. Next important, if I talk about enzyme inhibitors. एंजाइम इनहिबिटर्स में क्या होगा इफ यू गिव एनी अदर ड्रग बेटा विद एंजाइम इनहिबिटर तो क्या होगा this enzyme inhibitor is known to inhibit that microsomal enzymes due to which the drug will not be able to metabolize as the enzymes are inhibited and if the drug is not going to metabolize beta the other drug will develop टॉक्सिसिटी दूसरे ड्रग की जो साथ में दे रहे हो उसकी टॉक्सिसिटी हो सकती है बेटा नाउ इंपॉर्टेंट इज द निमोनिक टू रिमेंबर enzyme inhibitors will be vitamin K cannot cause enzyme inhibition so you can remember V for valproate, K for ketoconazole, C for cimetidine, C for ciprofloxacin, E for erythromycin and I for isoniazid. Now important is beta please remember basically याद रखना यहाँ पे मेजॉरिटी ऑफ द एंटीबायोटिक्स और एंटी माइक्रोबायल ड्रग्स विल बी एंजाइम इनहिबिटर्स बेटा तो याद रखना एक्सेप्शंस दैट मेजॉरिटी एंटीबायोटिक्स और एंटी माइक्रोबायल्स आर एंजाइम इनहिबिटर्स एक्सेप्ट rifampicin beta which is an enzyme inducer whereas majority of the anti-epileptic drugs are enzyme inducers beta except valproate which is an enzyme inhibitor these two are exceptions baki majority of them are same. Now, हमें पता है that in ATT beta, what is the ATT that we give? ATT में beta we give 2 months of intensive phase basically with HRZE that is isoniazid, rifampicin, pyrazinamide and ethambutol. Next 4 months of continuation phase with HRE beta that is isoniazid, rifampicin and ethambutol. Why pyrazinamide is discontinued in the continuation phase? Maximum hepatotoxicity is associated with pyrazinamide beta. Which anti-tubercular drug is known to cause vitamin B6 deficiency and peripheral neuropathy? Isoniazid is known to cause peripheral neuropathy. It can also cause a dangerous side effect that is SLE. हमें पता है that isoniazid is a part of the SHIP group of drugs beta and therefore known to increase the risk of SLE in the patient. Next, red-green color blindness is seen due to which drug? Ethambutol beta. Red green color blindness that is due to optic neuritis that happens due to ethambutol. And lastly, orange staining of secretions. So tears or the urine is stained orange in color beta due to the due to the rifampicin intake. That is important. अब हमें पता है that rifampicin is an enzyme inducer. If you give rifampicin along with OCPs beta, rifampicin will stimulate the enzyme due to which all the OCPs will get metabolized faster and then there will be failure of OCPs. इसी वजह से we have asked her to add a additional method of contraception. So why we have asked her to add a barrier method basically of contraception? The reason behind this is beta option D that is ATT that is anti-tubercular therapy or the rifampicin especially will induce the metabolism of OCPs and can cause failure beta. ठीक है? So that is what is important. Question number 80. You are working as a resident doctor beta at a district hospital and you have sent a blood sample for glucose estimation बच्चे. Which among the following enzyme will be inhibited beta by the chemical that is present in the vial that is used for sampling? I have told you this. So we know beta that this is a gray color vial definitely, and that gray color vial is going to contain a chemical known as sodium fluoride. And we know sodium fluoride is known to inhibit the second last enzyme of glycolysis known as option C, enolase beta. And as glycolysis stops, therefore, even if you check the blood sample after 10 hours beta, still the glucose values will be the same. Clear? That is important. If they ask you, this is the purple color vial. Purple color vial is known as the EDTA vial beta. Okay? The purple color or the lavender color vial, which is there definitely beta, it is generally known as the EDTA vial. And this EDTA vacuitainer, which is there beta, it is generally used to collect samples for CBC beta, that is complete blood count or any of the hematological test beta. Okay? Next important is this is the light blue color vial. Light blue color vial is definitely going to contain which anticoagulant inside it? Light blue color vial contains anticoagulant known as sodium citrate beta. So sodium citrate is present inside the light blue color vial and it is used to collect sample for coagulation test beta, that is PT, APTT. Okay, bleeding time for all of them definitely for coagulation test. You can collect the sample in the light blue color vial beta. That is what is important to be remembered. Hopefully that's clear to all of you now. Chalo. Next important if I talk about is question number 81 beta. If I talk about question number 81, here we are having a young patient bache, who is a known case of bronchial asthma. And currently the patient is taking treatment beta, along with white patches basically found inside the patient's oral cavity beta. So the patient is having white patches in the oral cavity as given with history of soreness. On peeling the patch basically beta, bleeding is observed. Which among the following shall be the drug prescribed into this patient? What is the diagnosis? So the diagnosis of this case is nothing else but oral candidiasis, also known as oral thrush beta. और हमें पता है oral candidiasis or oral thrush which is there definitely बच्चे. It is a fungal infection caused by Candida albicans beta, and that is seen in this patient. Why? What is the reason? Patient is a known case of asthma and currently taking treatment. What is the drug of choice for asthma? It is going to be inhaled corticosteroids beta. And हमें पता है as the patient is going to take inhaled steroids definitely, due to that the patient's local immunity is going to get suppressed beta. And as the local immunity is going to get suppressed, there will be increased risk of fungal infections like oral candidiasis. इसीलिए what should be the advice given? After taking steroid inhalers, patient has to wash or rinse the mouth with water beta. That is important to be remembered. So यहाँ पे you're able to see the scurdy whitish patch in the oral cavity beta, which is classical of oral candidiasis or oral thrush. What is the drug of choice? So either we can definitely give option D, that is clotrimazole beta, not cotrimoxazole. Cotrimoxazole is an antibiotic beta. It is a clotrimazole. Clotrimazole is an antifungal drug, or the another drug that we can use is going to be fluconazole. So clotrimazole or fluconazole beta are the drugs definitely used in the management of oral candidiasis. Erythromycin is given in the condition of diphtheria beta. Okay, cladarabin is the drug of choice for hairy cell leukemia. Cladarabin is given in hairy cell leukemia. Amphotericin B is given in severe fungal infections, which is like mucormycosis, Kala azar, or cryptococcal meningitis. Question number 8. इतना बता दो कैंडिडा के बारे में basically important. We know again it is a fungus beta. So here we will again use which mount? KOH mount for diagnosis. We will scrape out some patches beta and send it for KOH mount. And on that KOH mount, we are able to see what pseudo hyphae. Which phenomena is going to be present? Germ tube formation will be seen, or Raynaud's broad phenomena is going to be seen beta. Next, if I want to do a culture, so obviously SDA or Sabaros dextrose agar will be used. But If I want to do species identification, then what is used? Very good. So please remember beta, species identification की अगर मैं बात करूँ तो answer has to be chrome agar, and this was a PYQ again in the FMG exam. Clear है बात? Question number 82. This we have discussed. The below given bone which is there beta, it is derived from which embryological structure? कौन से embryological structure से derive किया गया है? What is the below given bone? So this is nothing else but incus beta. This is the body of incus. This is the body of incus. This is the lateral process of incus. This is definitely the long process of incus. And this is the lenticular process of incus beta. This is a classical picture of incus. And we know malleus and incus, both these ear ossicles are derived from option A, that is first pharyngeal arc beta. First cleft से क्या derive होता है? EAC beta, that is external auditory canal, is usually derived from the first pharyngeal cleft बच्चे. That is important to be remembered. चलो इतना बता दो मुझे बस. That is what is the incudostapedial malleolar joint पहले तो. We know that the incudo-malleolar joint which is there beta, it is an example of saddle joint बच्चे. Whereas the incudostapedial joint is very good. तो हमें पता है that incudostapedial joint, if they ask you beta, answer has to be the ball and socket joint beta. Chalo, done with this. That has to be kept in mind. Next important, if I talk about question number 83, a 49-year-old male beta was admitted in burns ward under surgery beta with 70% of total body surface area burns. He was started on high dose of broad spectrum antibiotics bache. 2 weeks later, now the patient starts complaining of abdominal pain along with diarrhea. Colonoscopic findings have been given below. Which among the following investigation will be done for patient's diagnosis? What is the provisional diagnosis? Hmm? Very good. It is a case of pseudomembranous colitis. Broad spectrum antibiotics like ceftriaxone or clindamycin will be given to the patient. And when we give third generation cephalosporins beta, or we usually give drugs like clindamycin, the normal bacteria of the intestines are killed and a pathogenic organism known as Clostridium difficile is going to grow beta. This Clostridium difficile is known to release toxins and that is known to cause inflammation beta called as pseudomembranous colitis. यहाँ पे भी picture अगर देखोगे of colonoscopy, you are able to see membrane like structures basically beta on the colonic wall. So it is a classical diagnosis of pseudomembranous colitis. ठीक है, these are exudates looking like membrane. What is the likely what is the likely diagnosis? Diagnostic test क्या करोगे? We know answer has to be option D, that is stool cytotoxin assay beta. I've told you this was a recent need question. That is stool cytotoxin assay is going to be done for diagnosis of pseudomembranous colitis. उस दिन भी मैंने मेडिसिन में बताया था, सॉरी सर्जरी में बताया था बेटा, डू रिमेंबर दैट. ठीक है. Fecal elastase levels are usually checked in patients of cystic fibrosis beta. Colonoscopic biopsy can be done in cancers basically beta. Here it is not needed. Fecal occult blood testing is again done for cancers, or definitely when a patient comes to you with blood hematochezia beta, you are not able to identify a cause. Clear hai baat? Chalo. So these are the things. What is going to be the drug of choice in patients of pseudomembranous colitis? What was the drug? Fidaxomicin beta. So fidaxomicin or vancomycin will be the drug of choice in patients of pseudomembranous colitis. Question number 84 beta. Here we are having a cattle breeder who presents to us with complaints of nausea, vomiting, fever and multiple buboes bache in the axilla and the groin region as well, which are tender on palpation, that is painful on palpation. Which of the following can be the vector beta for transmission of this disease? What is the diagnosis? What is the diagnosis? Cattle breeder है, multiple buboes दिख रहे हैं. Diagnosis of this case is straightforward bubonic plague. Bubo दिया हुआ था इतना साफ साफ. It is a case of bubonic plague, beta. Bubonic plague or any type of plague is caused by which organism? It is caused by an organism known as, or a bacteria known as Yersinia pestis. Which kind of appearance? Bipolar staining, that is safety pin-like appearance will be seen, beta. Important. Now this Yersinia pestis is usually transmitted by which vector? It is transmitted by option C, that is Xenopsilla chiopsis flea, beta. That is nothing else but rat flea. That is important. That has to be answer. तो यहाँ पे देख सकते हो बेटा that the sand fly, that is phlebotomous species basically beta, it is a vector for visceral leishmaniasis, that is kala azar, cutaneous leishmaniasis, that is oriental sore, also called as Delhi boil or Baghdad boil. Redovid bug which is there beta, this one redovid bug or a kissing bug, it is the vector for American trypanosomiasis, also known as Chagas disease. The rat flea, that is Xenopsilla chiopsis, it is known to transmit bubonic plague beta, also septicemic plague. Along with that, endemic typhus and chiggerosis beta. This is the snap of this one from the FMG snaps itself. PSM से निकाला है. So I hope you might have started 20 minutes, half an hour daily. Images देखना शुरू कर दो अभी से. ठीक है, so that is important. So that is things. Glossina sessifly is the vector for. Glossina sessifly is the vector for sleeping sickness. That is nothing else but African trypanosomiasis beta. That is what is important to be remembered. Chalo. If I talk about beta, question number 85. A child was diagnosed with an enzyme deficiency leading to a defective metabolism of ketogenic branch and amino acid beta. Sweaty feet like urine odor of the child is characteristic in this disease. Identify the amino acid which is not metabolized in this condition. ये मुझे बताओ, sweaty feet like urine odor is a feature of. Sweaty feet like urine odor or cheesy urine odor is a condition, is a feature of a condition known as isovaleric aciduria or isovaleric acidemia. Isovaleric aciduria or isovaleric acidemia happens when the patient has deficiency of which enzyme? Patient has deficiency of isovaleric coenzyme A dehydrogenase. Isovaleric coenzyme A dehydrogenase enzyme. इस एंजाइम की जब डेफिशिएंसी होती है, the patient develops isovaleric aciduria beta. That is what is important to be remembered. अब अगर वो पेशेंट में पूछते हैं that which branch in amino acid is not properly metabolized because this enzyme is deficient, तो answer will be option B, that is leucine. हमें पता है that leucine is not properly metabolized in a patient suffering from isovaleric aciduria. That has to be kept in mind. Now sweaty feet like urine odor नहीं बोलते, जो तुम सोच रहे हो बेसिकली उसमें कौन सा यूरिन ओडर होता है? It is caramel or a burnt sugar like urine odor. ठीक है, तो प्लीज रिमेंबर कैरामल और अ बर्न शुगर लाइक यूरिन ओडर इज अ फीचर ऑफ विच कंडीशन? मेपल सिरप यूरिन डिसीज बेटा. तो कैरामल और बर्न शुगर लाइक यूरिन ओडर इज अ क्लासिकल फीचर ऑफ मेपल सिरप यूरिन डिसीज. एंड मेपल सिरप यूरिन डिसीज की अगर मैं बात करूं, इन दिस कंडीशन डेफिनेटली बेटा द एंजाइम दैट इज गोइंग टू बी डेफिशिएंट विल बी कॉल्ड एज BCKD, that is branch chain alpha keto acid dehydrogenase or decarboxylase. So branch chain alpha keto acid dehydrogenase is deficient in patients of MSUD beta. And this condition mein, there is a defective metabolism of which amino acid? All the three branch chain amino acid. All the three branch chain amino acid का मतलब leucine, isoleucine and valine. तीनों का मेटाबॉलिज्म खराब होता है बेटा इन अ केस ऑफ मेपल सिरप यूरिन डिसीज. क्लियर है बात? चलो, hopefully that's clear. Question number 86, if I talk about beta, is identify the statistical diagram given in the image which is used to calculate basically the cumulative incidence beta of a disease in a population. So very good. Here you are able to see this looks like a line diagram beta, but is it a line diagram? No. Why? Because it is only and only going upwards. Line diagram can go upwards also and downwards also. If it is only going upwards, that means you are calculating incidence or cumulative incidence. We are then calculating a cumulative incidence. Matlab, we are adding up the new cases every year, beta. In the previous cases, we are adding up new cases. Last year 2000 थे, इस साल 3000 है. So we will plot the next point at 5000. ठीक है? तो मतलब हर साल नए cases add करते रहो बेटा. So the graph will keep on rising only. It will never come down. And this statistical diagram is known as option C, Ogaif beta. Clear? That is important. Line diagram जो होता है, here you are able to see. This is a classical picture of a line diagram, बच्चे. Line diagram can go upwards also and it can come downwards also. Why? Because here you are just going to plot the new number of cases every year. That is, you are just going to plot the incidence beta. Here we don't plot the cumulative incidence. Here we only plot incidence beta. That is what is the reason. Clear about one thing. Apart from that, if I talk about beta, about the line diagram. Sorry. Apart from this, if I talk about the line diagram beta, we know this is the best statistical diagram to represent which trend of the disease. The long-term fluctuation, that is secular trend of a disease, is best represented by a line diagram. Another PYQ from your examination. Do remember that. Okay? No issues with this, anybody? Question number 87, beta. Here we are having a child who is suffering from a genetic disorder, beta, with features like intellectual disability, beta, along with ataxia, seizures, and inappropriate laughter, beta. Which pattern of inheritance basically is going to be followed by this disease? So we know that what is the likely diagnosis? Very good. हमें पता है the diagnosis of this condition is Angelman syndrome. Patients of Angelman syndrome are classically referred to as happy puppets beta. We know these patients are going to have an uncontrollable laughter or inappropriate laughter, and therefore these are patients are called as happy puppets. And हमें पता है the diagnosis is Angelman syndrome. हमें पता है दो condition which can basically beta can inhibit by the same pattern of inheritance is Prader-Willi syndrome and Angelman syndrome. Both of them are due to defect or a mutation on which number chromosome? Chromosome number 15 beta. Chromosome 15 पे defect हो तो these conditions are going to happen बच्चे. तो याद रखना intellectual disability along with inappropriate laughter तो Angelman syndrome होगा. Obese patient, excessive eating, okay, and the patient having neurological features, then it is Prader-Willi syndrome. Please tell me beta, the pattern of inheritance will be option B, that is genomic imprinting, also called as gene silencing beta. मतलब क्या होता है? One of the gene beta, either maternal or paternal gene is going to get inactivated or silenced beta. That is what is important to be remembered. बोलो किसकी gene delete होती है Angelman syndrome में? We know beta who is angel, mother is an angel beta. तो ऐसे याद रख लो that maternal gene deletion is going to happen in Angelman syndrome and paternal disomy हो जाएगी. Whereas Prader-Willi syndrome, P for Prader-Willi, P for Papa. So definitely beta Prader-Willi syndrome में paternal gene deletion is going to happen बच्चे and maternal gene disomy is going to be present. Clear? Gonadal mosaicism का मतलब क्या? Mother is not having the disease, father is not having the disease, अचानक से बच्चा has a disease beta. This happens because there was some defect or mutation after fertilization beta once the zygote was formed. ठीक है? And usually a disease that follows gonadal mosaicism will be osteogenesis imperfecta. तो osteogenesis imperfecta can follow definitely beta gonadal mosaicism. Some cases, not all of them. ठीक है trinucleotide repeat expansion बच्चे we know there are multiple conditions like these conditions like Huntington's chorea. Huntington's में which repeats are going to be found? Huntington's chorea में CAG repeats will be there. Next is fragile X syndrome. Fragile X syndrome में which repeats? CGG repeats are seen in fragile X syndrome beta. Next is Friedreich's ataxia. Friedreich's ataxia में so it is the GAA repeats in Friedreich's ataxia. And last is myotonic dystrophy. So myotonic dystrophy mein it is the CTG repeats which will be found. Which diseases follow hexanucleotide repeat expansion? Hexa, 6 nucleotides are repeated. PYQ था तुम्हारा hexanucleotide repeat expansion. Frontotemporal dementia. So frontotemporal dementia and amyotrophic lateral sclerosis, ALS, both of them follow hexanucleotide repeat expansion, PYQ. Next, mitochondrial inheritance. Beta, we know mitochondrial inheritance is this. क्या दिख रहा है? If the mother is affected, beta, then how many children are affected? All the children of that mother, 100% children will be affected. And जहां जहां father affect होगा बेटा, ठीक है, यहाँ पे father affected था, कोई children affected है क्या? नहीं. जहां जहां mother affect होगी, सबके सब बच्चे affect हो जाएंगे बच्चे. That is what is very important about mitochondrial inheritance. Reason, all children, 100% of children beta will always get the mitochondria from the mother beta. So अगर mitochondria में कोई खराबी होगी तो सब बच्चों में जाएगी mother से. So example, if I talk about beta, it will be MELAS, that is mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes beta. Next is NARP syndrome beta. NARP syndrome is neurological manifestations, ataxia, and retinitis pigmentosa. Then there is Leigh syndrome, Leber's optic hereditary neuropathy, multiple of them. Question number 88, if I talk about, we are having a 10-month-old child bache who is brought to the PHC with a history of fever, cough, and cold beta. On examination, the child has a respiratory rate of 52 breaths per minute. Is it tachypnea? Yes. Reason हमें पता है, less than 2-month-old child में tachypnea होता है at more than 60 breaths per minute beta. Okay. 2 months to 1 year तक अगर बच्चा है तो it is seen when the respiratory rate is more than 50 breaths per minute beta. And lastly, more than 1 year का बच्चा है तो tachypnea is said when it is more than 40 breaths per minute बच्चे. That is important to be remembered. Now, यहाँ पे बच्चे में टैकिपनिया जरूर है. along with that the child is also having chest indrawing beta. ठीक है, तो according to the IMNCI guidelines, that is integrated management for neonatal and childhood illness, इसके guidelines के तहत you will classify the child into which category beta? Very good. तो हमें पता है बेटा that if the child is having any general danger sign मतलब either the child is unconscious, or the child is having persistent vomiting, or the child is having sorry, or the child is having seizures, or the child is extremely lethargic. ठीक है, these kind of signs are called as general danger signs beta. Or if there is a stridor or respiratory distress, all of this will be considered as pink category, that is of severe pneumonia or a very severe disease. Here we have to give first dose of ampicillin to the child beta. We have to give first dose of ampicillin to the child, or amoxicillin to the child बच्चे, and we will definitely refer the child immediately beta to a hospital or to a higher center. That is what is done in the pink category or severe pneumonia. Next, talking about beta, the yellow category. Here definitely if the child is having cold, cough, fever along with chest indrawing, that is chest retraction, or fast breathing beta, that is tachypnea, then we will classify the child into which category? Yellow category of pneumonia beta. And here we will give the child amoxicillin or any other antibiotic for a span of 5 days, and we will call the child for follow-up after 2 days. Follow-up should be done after 2 days beta. Next, if there are no enough signs to classify the condition as pneumonia or very severe pneumonia beta, then only if the child is having cough, cold and fever, we classify the child into green category of no pneumonia बच्चे. And अगर कोई pneumonia नहीं है, then we will just go for a symptomatic management. We will not start antibiotics in the child. That is what is important to be remembered. तो याद रखना, chest indrawing होने की वजह से वो कभी भी डायरेक्टली सीवियर निमोनिया नहीं होता है. ईदर रेस्पिरेटरी डिस्ट्रेस और स्ट्राइडर और एनी जनरल डेंजर साइंस. ओके, इट विल ओनली क्लासिफाई द चाइल्ड इनटू पिंक कैटेगरी. ये याद रखना. दिस इज नॉट ओनली बिकॉज ऑफ योर मिस्टेक. देयर आर डेफिनेटली द टेबल्स जहां पे गलती से इन्होंने चेस्ट एंड्रॉइंग पिंक में डाल के रखा हुआ है. So that is wrong. Answer has to be option B. That is nothing else but pneumonia beta. Question number 89. We have an 8-month-old child, definitely beta, had history of unusual crying and convulsions बच्चे following previous vaccination. तो previous vaccination के बाद the child had unusual crying and convulsions. Now parents have brought the child beta for the next dose of vaccination. Now which vaccine is contraindicated in this situation? बोलो. So history of unusual crying and convulsions after the vaccine, it's mainly due to the pertussis component beta. And अगर pertussis की वजह से हो रहा है तो better avoid pertussis in the child. Answer has to be option C, that is DPT should not be given. ठीक है? Can we give DT? Yes beta, it does not contain the pertussis. Can we give MR? Yes. Can we give JE? Yes. That is what is important. Now we know persistent inconsolable crying beta is a side effect that is commonly associated with pertussis vaccine. Anybody? Febrile seizures is associated with. Fever is associated with pertussis again, but febrile seizures or thrombocytopenia or toxic shock syndrome. अब तो बोलो. Yes, it is associated with measles or the MR vaccine. That is important to be remembered. Next important, hypersensitivity and shock. Hypersensitivity and shock are associated with hepatitis B, lymphadenopathy and osteomyelitis. कौन सा इन्फेक्शन है बोन एंड lymph nodes को इन्वॉल्व करने वाला? यस, BCG therefore. ठीक है, टीबी है ना, तो lymphadenopathy and osteomyelitis is BCG. This is adverse event basically beta due to BCG. That is what is important to be remembered. ठीक है, diarrhea or intersusception to be specific. Rotavirus beta. So diarrhea causing intersusception later on is going to be rotavirus. Hopefully clear. So remember, these are the important points that you need to remember about the adverse events or side effects following immunization. इसीलिए you have to keep the person under observation for a minimum span of 30 minutes beta. Question number 90. A patient was diagnosed as a case of pulmonary tuberculosis beta with CB NAT, that is cartridge based nucleic acid amplification test beta, and the gene expert assay which was there. It reveals definitely that there is resistance of isoniazid, rifampicin, levofloxacin, and amikacin. What is the likely status of the patient? Bolo. तो हमें पता है that only isoniazid and rifampicin होता तो I would have said it is a case of multi drug resistant TB. ठीक है, but यहाँ पे it is levofloxacin which is fluoroquinolone and amikacin also beta. तो answer has to be option D, that is extensively drug resistant TB, that is XDR TB beta. Please remember, XDR TB is not extremely, it is extensively drug resistant TB. Polydrug resistant TB matlab resistance to more than one anti-tubercular drug beta apart from isoniazid and rifampicin. उन दोनों को काउंट नहीं करना होता पॉलीड्रग रेजिस्टेंट टीबी में. Hopefully that's clear to all of you. याद रखना, the investigation to diagnose TB can be CB-NAT beta, and CB-NAT can tell you about which drug resistance, rifampicin. But for other drug resistance, you have to go for gene expert beta. So gene expert or line probe assay, these are the assays that will tell you about the resistance to the other forms of other types of anti-tubercular drugs beta. B-palm regime is generally followed for bolo. B-palm regime is followed for MDR or XDR TBs may definitely beta. You can follow the B-palm regime nowadays. And if I talk about the B-palm regime, B stands for bedaquiline, P stands for pretomanid, L stands for linezolid, and M stands for moxifloxacin beta. That is what is important to be remembered. Clear about? Chalo. Next important, if I talk about question number 91, a 30-year-old woman beta develops DVT or deep venous thrombosis in her left calf beta on post-op day 4 following a cesarean section done for fetal distress. The patient is started beta on heparin and is scheduled to begin a 3-month course of warfarin therapy also. Patient wants to do breastfeeding beta. She wants to do breastfeeding to the baby. What is the advice to be given beta to the mother? Answer has to be option D beta. That is nothing else but warfarin is absolutely safe during lactation. Warfarin is dangerous during pregnancy, beta. Usually in the first trimester of pregnancy, warfarin is dangerous. That too, when the embryogenesis or the organogenesis happens, it can cause a fetal warfarin syndrome, that is nasal hypoplasia or stippled epiphysis. ठीक है? तो warfarin जो होती है बेटा, it is contraindicated basically only in the first trimester of pregnancy. You can even shift back the patient in second and third trimester to warfarin. कोई दिक्कत नहीं है. So please remember, beta, that warfarin should not be given in the first trimester. First trimester, में the anticoagulant of choice should be heparin. Second and third trimester, में we can shift back the patient to warfarin. And again, near term, around 36, 37 weeks, we have to shift back to heparin, beta. That is what is important to be remembered. Okay? Warfarin is not contraindicated during lactation. Reason, the amount of warfarin in breast milk is very, very minimal. That does not cause any problem to the child as such, beta. Okay? So that is important to be remembered. Question number 92. Young sexually active female beta who presents to you with complaints of foul smelling, whitish vaginal discharge beta. She was started on treatment basically. And now after alcohol consumption beta, she was started on treatment. After alcohol consumption bache, she starts experiencing headache, nausea, vomiting and palpitation. That is unpleasant symptoms beta. Which among the following drug would be responsible for causing her symptoms? हमें पता है, the foul smelling whitish vaginal discharge would be a diagnosis of candidiasis में तुम metronidazole देते हो. Whitish vaginal discharge, which is foul smelling, is a feature of bacterial vaginosis, which is the most common vaginitis beta. Here there will be a whitish or a grayish vaginal discharge, and we know the patient will have definitely beta sorry, treatment, or like we will definitely do a AMSELS criteria. We will check first. Definitely there should be a grayish or whitish vaginal discharge along with clue cells beta, along with pH more than 4.5 beta, and last important, that is Nugent score. One is whitish vaginal discharge, second is clue cells, third is pH more than 4.5. Third is going to be a whiff test positive. That is adding 10% QH will give you a very fishy odor. That is important. Bacterial vaginosis में the drug of choice is metronidazole. और हमें पता है, if you give metronidazole to any patient beta and after that the patient takes alcohol, so the patient will have a disulfiram like reaction, and disulfiram like reaction will cause all these unpleasant symptoms. हमें पता है the drugs which are known to cause disulfiram like reaction beta, they can be remembered by this mnemonic. Sorry, Pluto can't go to mass. So please remember S for sulfonyl ureas, especially the first generations like chloropropamide or tolbutamide. Next, P stands for procarbazine. C stands for majority cephalosporins beta, especially C4-tetan or C4-perazone. Next, G stands for antifungal, that is glycopulvin, and M stands for anti-amoebic, that is metronidazole beta. Okay, these drugs are known to cause dry sulfiram like reaction. Matlab, they will inhibit which enzyme? They inhibit which enzyme? हमें पता है any enzyme that is sorry, any drug which has a dry sulfiram like action beta, it is known to inhibit an enzyme called as aldehyde dehydrogenase. And as aldehyde dehydrogenase enzyme is inhibited beta, due to that the alcohol is not completely broken down and excess amount of acetaldehyde collects in the patient's body, causing all these unpleasant symptoms beta. Hopefully that's clear to all of you now. So याद रखना ये बात. Done? Question number 93. A patient with acute psychosis beta who is on haloperidol for 20 mg per day for the last 2 days bache, had an episode basically characterized by tongue protrusion, stiffness, and abnormal posture of the limbs as well as trunk beta without any loss of consciousness. Matlab she was conscious but she had abnormal posture basically along with stiffness and tongue protrusion. Okay, it has lasted basically for the last 20 minutes before presenting to casualty. This improved within a few minutes beta after administration of a drug known as diphenhydramine chloride, hydrochloride. What is the most likely diagnosis? Bolo. Very good. We know that haloperidol belongs to which group of drugs? Antipsychotics. हमें पता है बेटा that antipsychotics are used in the management of acute psychosis or schizophrenia. तो acute psychosis या schizophrenia के cases में when we give antipsychotics, they are of two groups basically बेटा, typical and atypical बेटा. So when I talk about the typical antipsychotics, these are drugs like बोलो haloperidol, fluphenazine, droperidol, thioridazine, and atypical antipsychotics are usually drugs like क्लोजापिन, ओलैंजापिन, रेस्पेरिडोन. ठीक है, तो टिपिकल एंटीसाइकोटिक्स आर मेनली द डोपामिन एंटागोनिस्ट and atypical antipsychotics are mainly serotonin antagonists. Mainly, I'm saying, okay. Important is typical antipsychotics are known to cause which kind of side effects? EPS, that is extrapyramidal side effects are caused by typical antipsychotics, whereas endocrine side effects are mainly caused by atypical antipsychotics. Endocrine side effects are caused by atypical antipsychotics. अब extrapyramidal side effects की बात करूं तो we know that the most common extrapyramidal side effect is going to be acute akathisia, where the patient becomes restless beta and the patient keeps on walking here and there. ठीक है, drug of choice will be beta blockers like propranolol will be the drug of choice for acute akathisia. What is the earliest side effect beta? The earliest extrapyramidal side effect will be acute dystonia, when there is sudden spasm of a group of muscle. A group of muscles suddenly go into spasm beta, causing torticollis, trismus, these kind of problems beta after giving the drug. And here the drug of choice is going to be, it is going to be benzhexol beta, that is an anticholinergic drug. You can also give other drugs like promethazine as well. Next important is a condition known as tardive dyskinesia. Tardive dyskinesia is a long-term side effect beta, that is after few weeks or months, the patient may have some abnormal movements beta. Those are called as tardive dyskinesia. And here the drug of choice for tardive dyskinesia will be, anybody? Valbenazine beta. Valbenazine is the drug of choice. Now, sometimes the patient will also develop a classical triad, that is fever, along with muscle rigidity and elevated CPK levels. Fever, muscle rigidity, and elevated CPK levels is called as neuroleptic malignant syndrome. So after taking typical antipsychotic, fever, muscle rigidity, and elevated CPK levels is neuroleptic malignant syndrome. Drug of choice, dantrolene. So dantrolene sodium is going to be the drug of choice for NMS beta. And lastly, after giving typical antipsychotics, suddenly the dopamine levels of the patient are going to decrease, and that can actually cause bradykinesia, resting, pin rolling, tremors, and rigidity. That is known as drug-induced Parkinsonism. And what is the drug of choice for drug-induced Parkinsonism? Again, the drug of choice will be benzhexol, also called as trihexyphenidyl beta. Now, if this was about all the typical antipsychotics ka side effects known as extrapyramidal side effect, we know haloperidol is a typical antipsychotic, so it can cause extrapyramidal side effect, jahan pe there is tongue protrusion, stiffness, abnormal posture. That is due to sudden spasm in a group of muscle, and that is nothing else but a diagnosis of option B, that is acute dystonia. Clear? Important is that if they ask you in cases of atypical antipsychotics, beta like clozapine and all, we know these side effects are going to be sedation, excessive salivation, weight gain. Please tell me which drug is responsible for maximum saliva, maximum weight gain, maximum sedation. Clozapine itself. Clozapine is responsible for maximum sedation, maximum weight gain beta. Clozapine is also known to cause some dangerous side effects like agranulocytosis. So it should be stopped beta if the total leukocyte count of the patient decreases. That is what is important. Question number 94, easy. A person is poisoned by the ingredients of the shown plant fruit. So we know this plant fruit is nothing else but Dhatura beta. So this is definitely a Dhatura alba bache. There is also Dhatura nigra. And this is known as Dhatura stramonium, also called a Jimson's weed or thorn apple. Active principle of Dhatura is hyoscine and atropine, which are anticholinergic agents beta. Due to that, the patient will develop these 8 Ds. What are the 8 Ds? Dry mouth, dry skin, dysarthria, dysphagia, dilatation of pupil, that is mydriasis, delirium, drunken gait, and death eventually, beta. Fatal dose is going to be 100 seeds, beta. 100 seeds if the patient is going to consume. We know Datura is also known as railway side or a roadside poison, बच्चे. अब मुझे बताओ which among the following may not be associated with consumption of this plant seed, they are asking you. Very good. We know dysphagia can be seen, dry mouth can be seen, dysphagia can be seen. Diaphoresis is excessive sweating, beta. No, rather there is less amount of sweating which will happen, causing a dry skin basically. No diaphoresis is going to be present in this patient. What is the drug of choice for Datura poisoning? Yes. So drug of choice definitely for Dhatura poisoning is going to be physostigmine. So atropine and Dhatura poisoning, दोनों में the drug of choice is going to be physostigmine itself. That is important to be remembered. Pyridostigmine is the drug of choice for pyridostigmine. Myasthenia gravis. ठीक है, very good. Now here we are having a question which states a female presents with a history of amenorrhea, that is no menses beta, along with galactorrhea, that is excessive milk production beta, which can leak out at times. Along with decreased visual acuity, bache, she also complains of headache and decreased libido. Libido is sexual desire. The sexual desire of this female is less. Which among the following hormone definitely beta will help counter these symptoms of the patient? What is the diagnosis? What do you think? Yes, the patient is having a pituitary adenoma. Which type of pituitary adenoma? It is a prolactinoma beta. And as the patient is having a prolactinoma, therefore there is excess secretion of prolactin hormone bache known to cause definitely galactorrhea beta. So prolactinoma की वजह से the patient is basically having galactorrhea beta. But हमें पता है that prolactin is directly or inversely proportional to gonadotropins. It is inversely proportional to gonadotropins like LH and FSH. Matlab, if prolactin levels are going to increase, automatically the gonadotropin, that is LH and FSH levels are going to decrease. इसीलिए in lactation or breastfeeding period, when the prolactin levels are high in the body, LH and FSH levels are low, and due to that the patient does not get menses, that is lactational amenorrhea. Clear है बात? तो इसीलिए as prolactin levels are high beta, the patient may have the problems like amenorrhea along with decreased libido beta. Decreased visual acuity is because of compression of optic chiasma, and headache is also due to the increase in intracranial pressure. Those are symptoms of tumor. But the specific symptoms are basically due to deficiency of LH and FSH. So which hormones, if given, will help the patient? Option B, that is LH and FSH beta. We know prolactin is also an inversely proportional hormone to dopamine. मतलब जब prolactin levels are high, dopamine levels will also decrease. But dopamine अगर decrease होता तो the patient should have had symptoms of Parkinsonism. तो अगर Parkinsonism के symptoms होते तो we would have said that giving dopamine will help the patient. बराबर? But it is not a case of Parkinsonism. It is a case of amenorrhea and decreased libido बेटा. ठीक है? इंसुलिन और एड्रेनालिन का कोई संबंध नहीं है. Question number 96, straightforward question. A patient has been diagnosed with CHF or congestive heart failure and started on an oral inotropic agent called as digoxin therapy. He has sudden onset bradyarrhythmia beta. Bradyarrhythmia means something like heart block, when the heart rate of the patient suddenly decreases and the heart of the patient is not able to contract properly. Which among the following drug beta shall be used for the patient's treatment? Bolo. Very good. हमें पता है that whenever there is a digoxin induced bradyarrhythmia बच्चे, the drug of choice has to be option D, that is digibine. अगर digoxin induced tachyarrhythmia होता तो very good. Digoxin induced tachyarrhythmia होता बच्चे, तो the drug of choice would have been lignocaine, which is a sodium channel blocker. Lignocaine or even phenytoin for that matter. So lignocaine or phenytoin are used in conditions where the patient has a digoxin induced tachyarrhythmia. Reason, अगर तुम किसी पेशेंट को ब्रैडियरिथमिया है, हार्ट ब्लॉक है, हार्ट रेट उसका 50 पे है, if you are going to use drugs like lignocaine or phenytoin, which are sodium channel blockers, the heart rate of the patient will further decrease and the patient will die. ठीक है? तो lignocaine and phenytoin are only approved for tachyarrhythmias, not for bradyarrhythmias. Clear? Bradyarrhythmias के लिए we have to give the drug of choice, that is digibind only. Clear? Amiodarone is not used for digoxin induced arrhythmias beta. What are the most common side effect of digoxin toxicity? Hmm? Most common side effect of digoxin toxicity. Nausea and vomiting is the most common side effect. Now, arrhythmias can be one of those side effect beta. Okay, so that is what is important to remember. The patient will have yellowish vision. That yellowish vision is known as xanthopsia. Patient can have enlargement of breast called as gynecomastia. We know that digoxin is one of the disco drugs which can cause gynecomastia. Di for digoxin, S for spironolactone, C for cimetidine, O for K for ketoconazole and O for estrogens beta. That is important. Okay? Chalo. Question number 97, very easy. A man traveled to Assam beta. After coming back, he developed fever, chills, and rigors beta along with altered sensorium. The peripheral smear demonstrated the presence of Plasmodium falciparum beta. What is the treatment of choice for this patient? So, we know that the patient has come from Assam beta. Very good. It is a case of a complicated or a cerebral malaria. Why we are calling it a cerebral malaria beta? Yes, because the patient is having altered sensorium. So हमें पता है that if the patient is going to have an altered sensorium beta or any other neurological feature, it is a complicated or cerebral malaria which can only and only be caused by Plasmodium falciparum. और हमें पता है डेफिनेटली जब कॉम्प्लिकेटेड सेरेब्रल मलेरिया होता है तो देन वी हैव टू गिव ऑप्शन डी दैट इज इंट्रावीनस आरटी सुने डज नॉट मैटर from where the patient has come, whether from northeast or from any other part of India. Treatment is always intravenous drug emergency mein. Clear? Now, if I talk about basically beta, okay, if I talk about Plasmodium falciparum itself, basically, इन अ नॉर्मल पर्सन बेटा अनकॉम्प्लिकेटेड केस में प्लाज्मोडियम फैल्सिपारम की अगर हम बात करेंगे तो प्लीज टेल मी बेटा इफ द पेशेंट बिलोंग्स बेसिकली टू द नॉर्थ ईस्टर्न पार्ट्स ऑफ इंडिया देन व्हाट इज द ड्रग then the drug that we give beta will be RT mether plus lumifantrin beta. Whereas if the person belongs to rest of the India beta, then we have to give a combination of RT sunate beta along with sulfadoxine pyrimethamine combination बच्चे clear. If they say pregnancy, Plasmodium falciparum infection, uncomplicated in pregnancy. So first trimester में we cannot give artemisinin based combination therapy, so we give quinine beta. But second and third trimester में we easily give artemisinin based combination therapy beta. That is same depending on the location. Now if I talk about Plasmodium vivax beta, Plasmodium vivax या Plasmodium ovale, तो यहाँ पे the drug of choice is going to be chloroquine. The drug of choice for Plasmodium vivax or ovale is going to be chloroquine beta. And yes, as there is a very high chance of relapse, so relapse prevention के लिए drug of choice is primaquine. Now we know primaquine is highly teratogenic. So if they say female is having Plasmodium vivax infection during pregnancy, then what we should give? We should only and only give chloroquine beta. No primaquine should be given. Hopefully that's clear. Chemoprophylaxis अगर करना है मलेरिया के केसेस में बेटा then we have to give two drugs basically. If the patient is traveling for a span of less than equal to 6 weeks, doxycycline. तो prevention के लिए बेटा if the patient is traveling for a shorter duration of span, then we have to give doxycycline beta. But if the patient is traveling for longer time, more than 6 weeks, then we have to give mefloquine beta. That is important to be remembered. After coming back, we will continue the drug for how many weeks? 4 weeks, beta. After coming back, we will always continue the drug for 4 weeks. That has been a question. Question 98, beta. A child has been brought with complaints of bruising on the trunk, beta, and frequent epistaxis as well. CBC seems normal in the patient bache, along with the coagulogram, which reveals a prolonged BT and a APTT beta with a normal prothrombin time. What is the likely diagnosis of the patient? So I hope all of you are quite aware basically beta that bleeding time normally it is 2 to 8 minute beta. It is going to be prolonged whenever there is any problem with the platelets beta. Okay, any qualitative or quantitative defect with platelet. Prothrombin time, that is PT or INR, it is normally 11 to 16 seconds beta. it will be prolonged whenever there is any problem with the extrinsic pathway of coagulation, that is clotting factor number 7. And lastly, APTT, activated partial thromboplastin time, normally it ranges between 27 to maximum 45 seconds beta. It will be prolonged whenever there is any problem with the intrinsic pathway of coagulation, clotting factor number 12, 11, 9 and 8. Hopefully that's clear. अब मुझे बताओ, in a patient who is having hemophilia A, so we know beta hemophilia A में the deficiency is of clotting factor 8. So which time will be prolonged? Only the APTT will be prolonged beta. Will there be any problem with BT and PT? No. So definitely this is ruled out because they are saying the patient is having prolonged bleeding time also and APTT also beta. So obviously hemophilia is ruled out. Option B says Bernard-Sollier syndrome, which is a qualitative defect in platelets. The receptors on the platelets are defective, therefore platelet aggregation cannot happen. और अगर platelet जमा नहीं हो पाएंगे तो the which time will be prolonged? Bleeding time will be prolonged beta, but the other times will be absolutely normal. Therefore, we can rule this out also. Next is Wiskott-Aldrich syndrome. Wiskott-Aldrich syndrome due to VASP gene mutation. Here there is thrombocytopenia, that is quantitative defect of platelet, and therefore only which time will be prolonged? Only the bleeding time will be prolonged beta, no effect on PT and APTT. So again, this is ruled out. Answer has to be option D, that is von Willebrand disease, which is the most common hereditary bleeding disorder. And von Willebrand disease mein, as platelet aggregation cannot happen beta, therefore bleeding time is prolonged. And as clotting factor 8 ka activation cannot happen beta, therefore the APTT is also prolonged. So answer has to be option D, that is von Willebrand disease beta. Hopefully that's clear to all of you now. Question number 99. A boy presents to you beta with blackish discoloration of the eyes bache, and along with that even blackish discoloration of skin and ear pinna. Mother gives history of black color diapers beta in the child. Which among the following metabolite is most likely to be found in this patient's urine? Bolo. What is this blackish discoloration of sclera called as? Blackish discoloration of cartilage will be called as oochronosis. And we know the child who is having oochronosis along with black diapers or urine turns black on standing is a classical diagnosis of alkaptonuria. It is due to defective metabolism of which amino acid? Amino acid. टायरोजीन. तो टायरोजीन अमाइनो एसिड का डिफेक्ट अगर होगा मेटाबॉलिज्म में तब जाके ये प्रॉब्लम होती है. ड्यू टू विच एंजाइम डेफिशिएंसी? तो वी नो द एंजाइम दैट इज डेफिशिएंट बेटा in patients of alkaptonuria is a homogenesic acid oxidase or dioxygenase, which is known to break down that homogenesic acid. If this enzyme is not present, the patient's homogenesic acid is not broken down, and all of that either deposits or gets excreted out in the urine beta, and therefore you will be able to see high amounts of homogenesic acid in the patient's urine बचे. That is what is important to be remembered. कोई दिक्कत? ट्रीटमेंट क्या देना होगा इस पेशेंट में? We have to avoid which kind of diet? We have to avoid any kind of tyrosine and another amino acid which makes tyrosine. Phenylalanine in diet beta. दोनों के दोनों avoid करने पड़ेंगे. So avoid tyrosine as well as phenylalanine in the patient's diet. That is the treatment of alkaptonuria beta. ठीक है? If I talk about, definitely homocysteine will be excreted out in patients of homocystinuria, which happens due to B6, B9 or B12 deficiency. Hydroxyindolacetic acid 5-HIAA will be excreted out in patients suffering from any neuroendocrine tumor like carcinoids or medullary thyroid cancer or small cell carcinoma, any of them. ठीक है? Phenyl pyruvate will be excreted out in patients of PKU. What is PKU? Phenylketonuria beta. So we know that phenylketonuria pattern of inheritance is going to be autosomal recessive beta. That is important to be remembered. हमें पता है in this condition there is deficiency of which enzyme? Phenylalanine hydroxylase. This enzyme is going to be deficient, due to which phenylalanine is not converted into tyrosine, and therefore there is less amount of melanin in the patient's body, causing fair skin, blonde hair and blue iris beta. ठीक है, Russian patient will be there. Fair skin, blonde hair, blue iris will be there, beta, along with mousy or musty odor. So there will be a mousy or a musty body as well as urine odor in the patient, beta. That is important to be remembered. ठीक है. Treatment is obviously avoiding phenylalanine in the patient's diet, beta. Question number 100. It states, beta, that a boy presented to the OPD with voracious appetite, beta, along with generalized swelling of different body parts, that is anasarca or swelling was there. He is most likely suffering from which condition? So we know, beta, here if I talk about the differences between kwashiorkor and marasmus, which both of them are protein energy malnutrition. First of all, if I talk about kwashiorkor happens due to deficiency of proteins, but marasmus happens due to deficiency of proteins and calories both. Next, if they ask you, beta, kwashiorkor, we know it is common in children between 6 months to 3 years of age, whereas marasmus is more common in infants less than 1 year of age. Subcutaneous fat is lost in marasmus, beta, whereas edema is present in kwashiorkor. Enlarged fatty liver or hepatomegaly is a feature of kwashiorkor, beta. Ribs will be more prominent or wasting will be more severe in marasmus, beta. The child will be lethargic in which condition? Kwashiorkor. And the child will be alert and irritable in marasmus, beta. ठीक है? Mild or no muscle wasting in kwashiorkor, but a severe muscle wasting will be found in marasmus, beta. Poor appetite is a feature of kwashiorkor. Voracious appetite is a feature of marasmus, beta. Important if they ask you, definitely. Moon-like faces, kwashiorkor. Old man-like faces, marasmus, beta. That is important to be remembered. ठीक है? If they ask you, अब इस patient में तो voracious appetite भी है, that is suggestive of marasmus, and generalized swelling भी है, that is edema भी है, that is suggestive of kwashiorkor. So the better answer to be marked will be option C, that is marasmic kwashiorkor, beta. ठीक है? जाओ 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 जाओ.